from yesterday. You had some time to think or not think or whatever. And if you have any questions from yesterday, we'll start with that. No questions. Okay. So let's start with an exercise, and hold on one second, because in order to do that, I'll need a microphone. So,
Alex, I have a raised hand.
okay. Wrong chat.
I have a small question, maybe.
Oh, there is a question. Yes, go ahead.
When you palpate, do you need to feel something under your finger?
It's a very good question. Sometimes you do and sometimes you don't. So that's one possibility, that you'll feel something, but there's a good possibility that you won't. So it's the patient that says. So sometimes you feel tightness, sometimes you feel nodules, sometimes you feel like weird, too soft. And by the way, so for example, if it's too soft, the patient can scream. So don't assume that it's all tightness. It can be many, many different things that your fingers are feeling. So always pay attention to what you're feeling. However, your main feedback is the patient says, ouch, or uncomfortable or something. And then on the treatment point, ignore the patient as much as you can, because the point that's painful is not always effective. So they'll say, oh, yeah, that's the best point. It really hurts. It's like, no, look for something weird around the point. Again, like maybe a nodule, maybe a dent, maybe some puffiness, something strange. Okay. And we'll talk about it when we'll get to kidney 7 in a little bit. And I'll talk about that, that there's some clarity around there. On the treatment point, you're looking for what you're feeling yourself with your finger. But on the reflex, you're feeling, but you're trying as much as possible to rely on the patient, because then it's objective. When the patient says, ouch, and then you press on, say, Sanjo 8, and they go, wow, it's gone. You're not pressing it as hard. Okay, that's a very typical reaction. It's me. I'm not pressing as hard. It's not like it's gone, right? Then you know that something's different. And that's very important, because if you don't know that something, if you're just relying on your own, it's just like relying on the pulse. Are you really sure that it's changed, that the quality? Sometimes you can be really sure that the quality changed, but sometimes you're like, am I making it up? So the best way is to rely on the patient telling you, oh yeah, this is much better, 80% better, or whatever. That's the ideal situation, is that the patient communicates it back to you. Does that answer? All right. Anyone else? Hey. Oh. Alex? Oh, okay. No, you just... okay. So let's... everybody stand up. We're going to start with an exercise. And so this is, hopefully you can see what's going on here. So this is your heel, and this is your ankle bone, right? The internal malleolus and the heel. What you're going to do is you're going to send your heel down to the ground, and you're going to try and lift the ankle bone away from it. So you're creating the space of kidney 6. Hold on, don't do anything yet. As you're sending the heel down and lifting the ankle bone, what's going to happen is you're going to probably lift spleen 3 off the ground, because it's easier to lift the ankle bone. So just recognize...
Avi,
yes.
You get lots of cuts in your feet.
Oh, damn.
Your speech is
the
kind
microphone
of broken. And...
Is this better? Is this better?
Yes, it is. Thank you.
Okay. So let me see, because in a moment I'm going to stand, so it would be harder to... Okay. So as you lift the ankle bone away, spleen 3 is going to lift off the ground for many people. What you're trying to do is resist it. Now, the ankle bone's not going to come up a lot. So recognize that. It's not like you can, this is not going to go up to the knee. It's millimeters we're talking about. So stand up and send both heels to the ground and try and lift the ankle bone away without rolling onto the outside of the foot. And hopefully you're feeling the inside of the thigh. There's like a lift in the inside of the thigh. Not so much a tightening, but a lift. Can you feel that? Okay, great. So now take that thing between your thighs and with your imagination, relax your shoulders. Think as if there's a straw between your thighs and you're sucking the straw up into the perineal floor and up the front of the spine. We're creating the kidney channel basically. So heel down, ankle bone up. Inside of the thighs are activated, up the perineal floor, up the spine as far as you can, but relax the shoulders. Let the shoulder blades relax. And some people can bring it up all the way to the throat. Some people will stop somewhere at the navel. It all depends on your connections between the brain and the body. Okay, and over time it can change. Send the heel down. Don't lift spleen 3. Anchor spleen 3 down and feel that support of the spine from the inside of the thighs. Okay, you can let go, relax. All right. So this sending of the foot down, okay, activating the legs by sending the heel down, what you're doing, you're pushing something down in order to create a lift. Okay, so like, you know, there's a very famous song, you know, what goes up must come down. This is exactly the opposite. What pushes down will go up. Okay, you demonstrate it by in your own body. This concept, let me do the share now. This is called, in the Chinese, is called shuai. Okay, it really means to stomp. The character, you see it in red here. It's the foot on the left, and on the right side you have a mountain, something that grows up, and underneath it, something that pushes that grow like roots growing down. Okay, it really means the concentration of the foot. The foot is concentrating, the leg is concentrating. Okay, and that literally means to stomp, to push down in order to create an upward movement. And you see this character in the definition of the kidney channel, the bladder channel, and the spleen channel. Okay, now this shuai is very important because if you don't have it, if you don't use your legs, there's no support for the torso. Your perineal floor is kind of going to drop down. So people often say, use your core, and they mean your abdomen. But you know, Arnold Schwarzenegger, it does not have good core. He has maybe beautiful muscles, I don't know, maybe not anymore, but it's not about the muscular action in the abdomen. It's about the connection of the legs. The legs, the inside of the leg is supporting the abdomen. Okay, so you've experienced it yourself. Okay, now let's look at that concept a little bit more. So what is core strength? Okay, is it this guy on the left who's very buff, or is it that woman on the right side? Okay, and what you can see is she must have better core. And how do we know? Because she's off balance. He's just standing there, he's stuck, kind of thing. Now, you may think he has beautiful abdomens and beautiful arms and whatever, you know, like he can win a competition of something. But the thing is, she can move off balance, and the core, think about, for example, the core of an atom, okay, should be kind of hollow, soft, empty. The core in the storm is calm. Okay, so there has to be something that's almost hollow and yet controls everything in order to be the core. Okay, so your core starts at the legs. It isn't just in the abdomen. And what you can see here in this picture is that your core Your pubic bone is between your legs. Okay. Your perineal floor is supported by your legs. Okay. It's not above the legs. We tend to think of the abdomen as above the legs, and most of the abdomen is, but the root of the abdomen is actually between the thighs, between the legs. Okay, so that's very important to use the legs in order to support the perineal floor. The perineal floor in return supports the rest of the torso. If the torso is supported, your organs have space. So remember, we talked yesterday about first create the space between heaven and earth. This is it. Okay, this is how you do it. Okay, so you push down, the inner thighs get activated in order to create the perineal lift, which some people will call it Kegel exercises, okay, that you teach women in labor, in order to support the spine, okay? But it happens first from between the legs. Yes, as high up as you can in the thigh, but it does start, at around inner yin, 5 fingers above the knee. That's why inner yin is such an important point, because it affects the whole body. It creates the support for the whole body. Okay? So if you look at this surfer, for example, okay, I'm not a surfer, but you can see that this guy, he's sucking the board up into his feet, into his torso. He has core strength, but the core strength involves his legs. It's not just the abdomen. Okay, so there's this activity in the legs that supports, that allows the torso to be spacious and hollow. And hollow is a very important concept. Okay, so we talked about this character Chwai, the concentration of the foot. Something goes up, but because something went down. Okay, and what you're going to see is that most people, and this is the exercise that we did, the heel moves back, the internal malleolus moves up, so it separates kidney 6, and you're trying to leave spleen 3 on the ground. Okay, and that creates the space for the point that we call kidney 6, Jiao Hai. Jiao means to illuminate, to shed light, and Hai means ocean. So I'm going to argue here that the ocean here means the ocean of life, of your life. You're shedding light on your life. That's what kidney 6 does. Okay. Now, most of us, I know this is a weird picture, most of us, when we stand, we don't have to use Chwai. Okay, we don't have to press down. We're just schlepping around. Okay, we're just walking around. But if you were to stand on your hands, you can see immediately you're going to have to really push into the hand, because we don't normally stand on our hands. So we're going to really have to activate. So you can see that this guy has to activate something. And you can see, even though you don't see the whole torso, but you can see that his abdomen is elongated, that even by using the arms, using so-called Chwai in the arm, which would be called something else because it can't have the foot character, it will have the arm character, but nonetheless, it creates space in the torso. And it's a little bit more obvious when people do handstands, simply because when we're walking on our feet, we're used to it.
Okay, on the what stance?
Hand stand. He's standing on his hands. Make sense? Okay, so when you're handstanding, you have to push the ground in order to stand. When you're standing on your feet, you can afford to just do nothing. Okay, because that's kind of more natural for us, but it's not necessarily good for us. It doesn't create the space. Okay, so people who don't have Chwai, okay, there is the weight just falls into the legs. Okay, so you see these 2 women, okay, they're just kind of schlepping down. They're not in, and both of them, in fact, their heels are not on the floor. So that's a telltale sign when a patient comes in and they're sitting and the heels are off the floor. They're not sending the heel down into the ground. Chances are they're not using the legs. Okay. Without this using the ground, without anchoring into the ground, you're not going to be able to resist gravity. Okay, which means your perineal floor and your spine are going to drop, which means the organs don't have enough space. Okay, so the patient that comes in and they'll have their heels will be off the floor. What they'll do is they'll be sitting back. They'll sit on the buttocks, kind of leaning back on the back towards the back of the chair. They're not sitting on their thighs. Okay, so there's a difference. If you're sitting on your thighs, think of yourself as sitting on bladder 35. Bladder 36, bladder 37. Okay, don't think of yourself as sitting on gallbladder 30 or even above. The buttocks, the glute, really should be off the chair as much as possible. When they're walking, they're going to shuffle. They're going to be slumping. Okay, and because there is not enough holding in the lower body, something has to bring them up. They're going to have a lot of tension in the upper body. Okay, so the neck and the shoulders are going to be tight and lifted up. Okay, now, who does this describe? Probably 95% of your patients, right? You know, that's just the nature of what we do. Now, I have another picture, just kind of like, here is somebody who's like, she definitely has no choice. She's sitting on her buttocks. Do you see what, you know, she's basically sitting backwards. You know, she's not using her legs. So let's do another exercise as we're sitting here right now. Okay, so I'm assuming you're sitting on the chair. Sit with your feet about hip distance apart. Sit on the front of the chair. Don't lean back on the back of the chair. And ensure your glute is as much off the chair, is not slumping down into the chair. Now, again, activate kidney 6. Send the heel down and lift the ankle bone away. Keep spleen 3 on the ground. Send the knees away. Send the knee forward, away from you. And take your hip bones, the iliac crest, widen the hip bones apart. So the sacrum is given space between the hip bones. Knees forward, hip bones apart. That creates space in the hip joint, right? Now, what I want you to do is relax it all and just let the knees go towards each other. Drop the knees in. You've basically let go of liver 4 here. Now, don't do anything in the knees. Think of activating liver 4, and that will open the knees to be hip width apart, and you can reestablish the pattern. So you can
Repeat your last, please.
Okay. So drop the knees towards each other. Now activate liver 4. Send the heel down. Activate kidney 6 and activate liver 4 consciously. You'll notice your knees are now separating again. They come to hip distance. Keep liver 4 mentally activated and you feel stomach 30 area hollowing. Anybody has questions on that? We're trying to not be this woman in blue in this picture. Okay. Anybody with any questions on that exercise? Okay.
Hey, Avi.
Yes. Hello.
You can hear me?
I can hear you.
Yeah. Okay, great. So when that happens, when you're lifting from liver 4, hollowing out through stomach 30, do you have any other like acupuncture point body imaging to avoid people from then pushing the chest out too much? Because if you're going in that direction, then you know the chances that you're going to have a hyperlordosis.
No, you actually no. If you're really doing it, if you're really using the legs, and if you send your knees forward and widen the hip bones apart away from each other, the moment you
I see. Yeah.
you're narrowing the hips. There is no way you can hyperlordotic and keep the hip bones apart. Sorry.
Got it. No, it's I that's the cue I was missing. It was the knees forward with the spreading of the hips. That's what does it.
Yes, but it's an excellent point, because what you've just proven through this question is the importance of the sacroiliac ligaments. How important are the sacroiliac ligaments for everything, literally everything in the body? Okay, they're that place that holds everything. They're the central place that they're part of the core. The sacroiliac ligaments are really part of the core. Why? Because they're holding the iliac bones which are still part of the torso, but are really they're not the base of the legs, but the iliac is kind of somewhat part of the leg, even though it's part of the torso. And the sacrum is definitely part of the torso. So the sacroiliac ligaments are this weird phenomenon that holds this whole perineal floor. It's part of what holds the perineal floor together. Okay, and because these are the biggest things that happen, because in the front you have all these little ligaments that hold the pubic bone and stuff like that. These are tiny, but here you have pretty big ligaments that can get ropey. So they're subject to torque in a way that most other ligaments are not. And we'll talk about that in a moment. Okay. Anyone else? So how many of you have pain currently at this moment, feel some sort of pain? Can be chronic, can be acute, whatever. Okay, I can see one. Let me just see. Okay. Let me just put you on gallery. Okay, there's only, okay. So those of you who have pain, it's not helping because many people are not on, not on video. So those of you who do
There's
have
Carl
pain,
and Nicole having a
Yeah.
question.
I did see, yeah. Oh, was it a question or was it saying I have pain? Was I have pain? Okay. So now, those of you who have pain, send your heel down, lift the ankle bone away, keep spleen 3 on the ground, mentally activate liver 4, send the knees forward, widen the iliac bones away from each other, feel the opening in the abdomen, the hollowness in the abdomen, relax the shoulder blades, and open the back of the neck, relax the throat, because as we're doing it all, we're kind of trying a little too hard with our chins. Okay. Now, how is your pain having done all that? And you're doing it sitting. Okay. There's a very good chance at this second, as you're activating, that your pain is less. I'm not saying it's gone forever, but there's a good chance your pain is less. Okay, so I see Nicole is nodding yes. All right. Carl, was that a yes or no? Okay, so something's happening to your pain. Okay, today is about pain, so it's very important. So this is a trick that you can give people every so often. As you're sitting, do this. As you're standing, as you're walking, stop walking for a second, send your heel down, lift the ankle bone away, feel your perineal floor. Just stop for a second, create space, and move on. It's a great trick for pain. And we're going to now look at how we're doing that with acupuncture. Okay, so let me share the screen and move back to, so we have undone this poor woman in blue. Okay, we have learned how to not look like her. Okay, to activate stuff in our body so we actually have an upright posture. Okay, so what are the points that that can induce the chwai? Okay, so definitely kidney 6. That's very obvious because we did that. But I'm going to argue that actually kidney 7 can do that even better sometimes. So depending on the person. Okay? Then spleen 3 was involved. And yesterday we saw that the name of spleen 3, the great white, that white means like the sun is rising. It has something to do with moving up. And on the bladder, you're going to have bladder 36, because you're sitting literally on bladder 36, which is called supporting the support, Cheng Fu, to support, to receive the support. And bladder 58, Fei Yang. Okay. And stomach 41, we haven't really seen because we sort of talked about it as if it's liver 4, because I wanted to show you the connection between liver 4 and stomach 30. But stomach 41 is the hinge on the ankle, and that has to be a little bit, you have to kind of free it. So stomach 41 can induce the chwai, even though the stomach channel officially, according to Ling Shu chapter 2, does not have the character chwai in the description. And then
you mind repeating your last about the Chinese character?
Yeah, so the character chwai appears in Ling Shu when it describes the spleen channel, the kidney channel, and the bladder channel, not the stomach channel. Okay, they never say chwai. in the description of the stomach channel. Okay, but still stomach 41 is involved in the Chwai. So you can say, oh, it's the pair of the spleen, whatever you want. You can make excuses for everything. It's fine. So, and notice that is why I don't include liver 4 here. You know, and inner yin, which is on the kidney channel, 5 fingers above kidney 9, kidney 10, is definitely involved in the Chwai. That is, the whole preparation below the knee is in order to create the thigh activated and working, okay, and supporting the perineal floor. So those are the points that we use to create the Chwai. The Chwai then has to be continued into the torso, but that's a slightly different story. Okay, now kidney 7. The name Fulyu means, Fu means to repeat, to recover, and Liu means like skating. Okay, so it suggests to recover the flow, of, we'll call it the kidney channel that moves upwards. So kidney 7, whoops, sorry, stop the share so you can see. So on kidney 7, can you see? Okay. There is this triangle here, right? It's formed by the Achilles tendon and something to whatever these muscles are. We say kidney 7 is at the top of this triangle. Okay. So what happens is things start to fall down. The gastrocnemius starts to fall down, and you will feel in kidney 7, you'll feel like when you slide very gently, you feel like something kind of pushes down towards you, and it can be in different places. Okay, and that's the kidney 7. Okay, I'm always looking for kidney 7 that's going to that's going to affect the Chwai, that's going to counter the falling down, that's going to recover the flow upwards, make things move up. Okay, so that's why kidney 7 often is better than kidney 6. Okay, in creating this Chwai. All right, so sorry. Every time I share. Yes.
So that technique that you do where you like slide and then there's like a stop, that's the same that you did in the arm for pericardium 4.
Yes, but the feeling is different. What I'm feeling at pericardium 4 is a dent. What I'm feeling at kidney 7, I'm sliding very gently, so I'm not creating anything. At kidney 7, I'm not looking for a dent so much. I'm looking for, there's going to be like almost some resistance to this very slight whooshy movement with my finger, and suddenly I'm feeling something. It's very slight. It's not like I have 50 kilograms pushing down on me. Plus the person's lying down, so it's not really. I'm just feeling ever so slight resistance, and it's a little bit. It can feel like a nodule. It can feel like a dent. But the main thing is there's something that suddenly my finger's moving, nothing, everything's fine, and suddenly, something stops the finger a little bit, moves against it. That's different than I'm looking for a dent. Like in liver 9, I'm sliding, I'm looking for a dent. Pericardium 4, I'm sliding, looking for a dent. This is definitely different. It's not, I'm not looking for a dent for kidney 7. I'm looking for something that my finger feels a teeny bit resistance.
Understood.
Okay. All right.
I have a question.
Yes, please.
Do I understand that you choose one of these?
No.
You go 6,
Oh,
kidney 6 or
either 6 or 7.
7.
Yeah, either 6 or 7.
Okay.
And then inner yin for sure. Okay, so one, kidney 6 or kidney 7, probably not both, inner yin. And then possibly I might add stomach 41. I might add spleen 3. I might add more if I'm not getting what I want. But the basics of it is kidney 6 or 7 plus inner yin. Inner yin you cannot ignore. You just can't ignore inner yin. Okay, and then we'll see a little bit extra in a moment. Okay, we actually talked about this, about the lifting before. Yesterday I gave you a protocol that I said kidney 6 at that point, but it can be either. Anyone else? All right, so back to the share. Okay, So that was creating the chwai, but now we have to continue it and create the space in the abdomen. We now have to actually do something with that. We created the
J'ai une
possibility.
question.
Yes, one more question. Yes. Oops.
De quelle façon est-il
How
Oui.
can we, how do we puncture inner yin?
Inner
What is
yin.
the angle of puncture of inner yin?
Okay. So you needle it in, but so if the person's lying face up, needle it in and slightly up towards the stomach or gallbladder channel. The person is lying face up, you're needling inner yin, not towards the not towards the inguinal, not towards the knee, straight in, but up slightly towards the stomach. Think of going towards stomach or gallbladder channel. Okay, because inner yin is lower when you're face down. Inner yin, the kidney channel, is lower than the gallbladder channel. The gallbladder channel is a little bit more towards the ceiling when they're lying down. The stomach channel is very much towards the ceiling. Okay, so think you're trying to needle inner yin, not straight in, parallel to the bed, but slightly up towards the ceiling, slightly up towards the ceiling. You're looking very confused.
Yeah, well, so something like 30-degree angle or whatever towards
Yeah,
the
whatever
stomach
you can
channel.
get.
It's clear. So
Yeah, I'll tell you, some points I can say do this angle, but when the muscle there is too tight, it's the same with the sacroiliac ligaments. I can say do this angle. At the end of the day, it's going to look like it's 90 degrees. So you're aiming slightly up towards the ceiling, but chances are, because it's a lot of muscles here, the muscles are going to win over your needle. But you're making the attempt to go slightly towards the stomach channel. Okay? So, all right, back. So now let's look at how do we create the space.
Est-ce qu'il pique profond? Quelle longueur de
how
pique?
deep? How deep, depending on the flesh or what kind of needle you're using.
Okay, so with me, I don't have a needle. Generally speaking, I never use a needle that's more than 30 millimeters, and I only use 0.18. Okay, so number one, like the Seri number ones, the reds, and on feet or face or whatever, I use 15 millimeters, and I use the 0.12, the greens, the dark greens. So I don't use, very rarely I'll use 40 millimeters, but generally I don't. So I don't even have the option of going more than, say, half its on. So depth doesn't matter. Okay, what I'm trying to get is the connective tissue. So if you have a needle that's very long, like, the 3-inch needle, and really sap it, and if I'm tapping on the connective tissue, the effect of the needle through the vibration keeps going into the body. I don't have to get the tip of the needle all the way into 3 inches in. I should be able to. The needle is just below the skin, and the vibration of the needle should move downwards to wherever the target is. So generally speaking, I'm not a believer in depth needling. Okay, and the other thing is you needle, and you sort of see what happens, what the response is in the abdomen or whatever. If you're not getting the response you want, but when you pressed on the point, you got a good response, you can manipulate the needle a little bit, maybe go a little bit deeper. You can do change the angle. Needle technique is a very weird subject, because everybody has different ideas about it. There are people who say you don't need to do anything, just stick the damn needle in and forget it. That's it. Then there are the people who are, oh no, you have to do, there are all these classical techniques, and if you don't do, and most people don't even know how to do these techniques. It's all very nice in theory, but how many people have you seen? And I'll tell the answer for me. I've seen one in my life. Okay, and I've been an acupuncturist for over 30 years. Someone who can put a needle in and is not fishing, is not doing something weird to get the chi. I know one woman, she puts the needle in and she says to you, a little shock. And when the k comes out of her mouth, you're jumping. Okay, how many people can do that? Very, very, very few people. If I set my standard to be able to do Chinese style manipulation and get the chi that way, as opposed to, you know, what most people do is they put the needle in and they start rotating and moving and can you feel it? Can you feel it? Oh, now you feel it. Oh, thank God you're feeling it already. Okay. That to me is not getting the chi. That's playing. Okay. So since most of us are playing, for me, needle technique is not, you know, this whole depth and stuff is not as important. I'm really just interested in, I'm trying to vibrate the connective tissue, the fascia, and that will send messages throughout the body. Okay, because the fascia is everywhere. If you break down the gumminess in the fascia, it's going to send electrical and chemical signals throughout the whole body. Exactly what it's doing, I have no idea. And I don't think anybody does. So it's a bit of a long answer to that question. So are we good to continue? Yes. Okay. We've been trying to get to this slide for a bit. So, all right. So now we want to establish the actual perineal floor. We did the preparation. We did the basement. We gave it the roots. Now it has to actually happen. Okay. The perineal floor, the lower abdomen has to be hollow and lifted. Okay. So we use inner yin. We know that. And then here is this point, the side gallbladder 28. Okay. To squeeze from the side, come from the side and elongate whatever is in the center, which is the torso. Now, liver 4 can help with that also. Okay, so we already saw inner yin before, and I told you it's essential. The side gallbladder 28 is also essential. Liver 4 is optional. You might use it, but I want to show this to you because liver 4, the name, the feng in liver 4, the name for liver 4 is the authority over the center. Zong feng. Okay. This feng in the center, the part on the left hand of liver 4, okay, is the same as in the center of stomach 30 of the jie, because the jie, which means it's the qi thoroughfare. I know people call it qi cheng nowadays, but if you look at the Ling Shu, it's called qi jie. Jie means like a big avenue. Okay. What does a big avenue mean? It means you can walk. The character to walk is around this character. Okay. With authority, as opposed to like in a little dark, narrow alley, you can't really walk with authority because, well, it's scary in a dark alley, but in a big avenue, you see everything. You can walk around in authority. These avenues are built for the generals to have parades in, kind of thing. Okay. So the authority over the center liver 4 affects the qi avenue, the place where the authority is flown through. Now, Ling Shu chapter 2, it's Ling Shu chapter 2. Says something. I think that before I told you chapter 2, when I actually meant chapter 10, when I'm talking about the description of the channels, it's chapter 10. But this one is in chapter 2. In Ling Shu chapter 2, it says, it names all the 5 element points kind of things for all the channels. But when it comes to liver 4, which is the metal point, okay, it stops for a second. It says liver 4 should be located 1 sun below the ankle bone. That's how I got my location. Okay. And it also says it induces, if you needle it, if you go with the flow, you create harmony. Where? In the center, in the abdomen. And if you needle it against, if you go against the point, you create chaos. Okay. And it's the only point that it talks about. You know, you have 5 times 12. There's at least 60 points mentioned in this chapter, you know, and it says this point is this point is this, but liver 4, it has something special to say. So there's something very unique about liver 4. Liver 4 is a great point to release the psoas. And the psoas is very important because the psoas controls the autonomic nervous system. When an animal is about to be killed, you know, like the lion catches the smaller animal, the animal that's about to be killed contracts totally, and the psoas contracts. That's a shock mechanism. why? To shut down the nervous system, because if you're going to be eaten by someone, it's better that you don't feel anything. It's nicer for you, right? So the shock response happens in the psoas, okay, and liver 4 can release it. All right. So then, in order to create the perineal floor, you have to also release the tension in the neck, because what happens is most of us, because we don't use our legs, okay, then we pull everything up with our throat, with our chin, okay? So we use the top of the body to lift us up instead of using our legs. So what I've done up to now is I've done points to create the chwai in the leg and the perineal floor, but I now have to somehow relax the habit of holding myself up with my jaw, or my chin, my throat, my shoulders. So I can use these tooth fairy points, which is under under the gums, sort of thing, under the teeth, or of course you're needling it actually, externally. Don't go into the mouth, okay? Or I can needle stomach 9, and I can also needle UB2, bladder 2. These are all points that will have an effect of releasing the neck and therefore encouraging the person to connect to the perineal floor. Okay. Otherwise, you're trying to connect the perineal floor, but the habit of tension in the upper body is constantly there. So you're trying to undo that. Okay.
Can you repeat the points? You said those 4 points. You mean
Okay,
those
stomach
two?
9. Okay. So these tooth fairy points under the chin, or don't use them all, or stomach 9 might do it, or bladder 2. So you have 3 options to try and relax the neck in order to make the person understand that they need to connect to the perineal floor. Stomach 9, tooth fairy, or bladder 2. Okay. So another principle that's very important is to untighten the diaphragm. So Carl was saying, oh, like so many people push themselves forward, that diaphragm gets tight. I'm not that interested in the lordotic curve, but I am very interested in the diaphragm being pushed that way. Okay. So in order to create the space in both the chest and the abdomen, the diaphragm has to be kind of loose. The diaphragm moves, but you don't want it pushing out. Okay. And the diaphragm, as we all know, releases the nervous system. If the diaphragm is tight, the nervous system is going to tighten. If the diaphragm is free, the nervous system gets a chance to relax and be smooth. Okay, so the diaphragm is extremely, extremely important. Okay, so in order to do that, we want to, first of all, make sure the scalenes are released. So again, the throat is released. You see how the throat still connects to the other 2 diaphragms. And releasing the scalenes, primarily spleen 3 and inner yin. We've seen those before. Okay, and then I can also do this thing where we talked just about gallbladder 29, okay, to release, to separate the thigh from the torso. That allows the diaphragm to open. And then also to release the vagus and the phrenic nerves, that will be Sanjiao 8. And then other points that open the diaphragm are bladder 2. So bladder 2 does relax the diaphragm. It also relaxes the neck, the back of the neck. The point under the 3rd toe, which is really for blood pressure, also relaxes the diaphragm. And when I do the back, I will definitely do 2, and I will also do 15 upwards, so that I'm kind of trying to send the whole spine up. And in the center of it, I will needle T7, which is the diaphragm shoe. Okay, so that's for untightening the diaphragm. And here is a picture of this gallbladder 29. So don't take it on the trochanter, take it slightly forward or slightly up. So you're looking for the space between the trochanter and the iliac crest. Okay, so you're looking to create the space. Now in this picture, they drew it so that there's a huge amount of space between the greater trochanter and the iliac crest. That's not true for many people. For many people, there's a lot less space there. Okay, now I don't know because I don't do it with x-rays, but that's what it seems like. Okay, so again, this is a point that creates the space in the abdomen. So I'm showing you Shimen. Shimen sends blood to the abdomen. Okay, and again, I'm doing it so you can see when someone stands on their hands, it's very obvious that there's a crack, but you can see it on me. I'm not standing on my hands or doing anything weird here. That's just my arm. Okay. And you can see that there are two dents, clefts there, cracks. One is 3 fingers below pericardium 3, and one is about 5 tsum below. Okay. But I don't find that the lower one works very well. The upper one does. And just so that there's clarity, pericardium 4 by the textbook is somewhere here. Okay, I think it says 4 or 5 tsund. I believe it's 4 tsund above the wrist. And
Yeah,
I'm
5, yes, 5 above the wrist.
5 above the wrist. And I'm talking about maybe at the most 5 below the elbow. So there's at least 2 tsund difference. Okay, so if you're looking for something that really has the shi in it, the crack in it, those are the points. Okay, and like I said, the upper one is the one I use. I don't use the lower one. Okay, and here is a picture of under the third toe. Okay, that we've talked about before, but now you have a picture. And the next thing we're going to do is we're going to look at how to, it's very important to relax the brain. Okay, now, so the thing about number 5 and 6, I'm doing those on the back. So I'm continuing to number 7. So the order here is not so important, just because we're on the front of the body right now. The patient is lying face up. So what can I do to relax the brain? So for a second here, let me stop the share for a moment. So when you're sitting here, don't look at the screen. There's nothing to see about me, but open your eyes. And look above your screen if possible, but don't look up with your head. And see if you notice that perhaps you're against a wall. You're looking at a wall. In my case, I'm looking outside my door, so I see trees. Okay. And notice that what we tend to do when we look at things, I am sending my eyes out to catch whatever I'm seeing. Undo that habit and allow your eyes to move back, to recede, to move back towards the back of the skull. It's going to feel a little odd that my eyes are open and I'm seeing things and I'm not sending my eyes out. I'm just allowing the world to come to me and keep coming back towards the back of my skull. Okay. What does that feel like? It should feel very relaxing, although a little confusing. Okay. This is sending the brain backwards. Instead of pushing out and looking, I'm exaggerating. You can look at me right now. It's okay. And instead of looking at things, I'm sending my eyes out. I'm relaxing the eyes and allowing them to fall back. Now, when you're lying face up, you can actually close your eyes and allow gravity to bring your eyes backwards. Okay. And that you can feel sends a wave of relaxation into the neck. Okay. So, Carl, you asked me yesterday, like, do I give people, lifestyle and exercise? These are the kinds of exercises that I give people, how to use their body. Okay. So often after I put the needles in, I say, okay, relax, close your eyes, let your eyes fall back towards the pillow, towards the back of the skull. Feel your neck relaxing, feel your whole back opening into the table. Okay, so I'm a little bit more into that kind of stuff than, if you drink coffee, make sure it's with soy latte also only or whatever, that kind of stuff, because they're not going to do it. They're going to do whatever they want. So, but anyway, okay, so this is called sending the brain back. So for those of you who've had pain, you can close your eyes and do the same thing. Just allow the eyes to move back towards the back of the skull. And then drop your chin slightly, and you can even do the whispering ah that we did yesterday. So open your jaw, let the jaw drop, relaxed, The teeth go on the back of the lower teeth. The tongue goes on the back of the lower teeth. And just hiss it out without a big breath. Just. And how does your pain feel? Do triple the whole thing. Put your heels down, send your heel down, lift the ankle bone away, activate the inner thigh, open the iliac crests, the posterior iliac, widen it so the sacrum is free, the abdomen is hollow. Now hollow the jaw, open the jaw, and relax the eyes back. Where is your pain? Buddy, with a comment on that. You don't need to do it for 30 minutes. You just do it. Of course, at the beginning, it takes time to figure out how to do it. And the pain generally dissipates. And those of you who don't have pain, what you feel like, wow, there's this weird space. And it's weird because it's a space that I'm not grabbing. I'm not controlling, but I feel it. It's there. And I can operate as a perfectly normal human being without pushing my eyes forward. I'm just allowing the world to come in. Okay. It's a habit that we have. And I'm doing it all the time. Right now I'm looking at the screen and I'm pushing my eyes out. We're constantly doing this. You have to remember that the eyes are an organ of perception, which means that in pain is the perception. So it's extremely important to relax the eyes so our perception is looser. Okay, so relaxing the brain, send the brain backwards, is what we're trying to do. Okay, so that's what we're trying to do. We're trying to be a little Buddha here. Okay, so if we're looking at the occiput, at the names of the points here, there's wind points. Wind means movement. Okay, so if I'm throwing my head back and I'm closing the occipital ridge, okay, closing gallbladder 20, do 16, what happens is all the movement in the brain gets stuck in the brain, and I'm not going to be able to relax the brain. In order to relax the brain, I have to open this area up so that the wind of the brain can dissipate, can be vented, and there can be a good flow between the body and the brain. So if you ask any meditator, okay, about the posture for meditation, one of the points of posture for meditation is tuck the chin slightly, very slightly, not a lot, just a little bit, in order to open up the back of the neck. And that relaxes the brain, allows the brain to. So often if you're sitting meditating and you're falling asleep kind of thing, or you're having daydreams, the advice is adjust the posture. Bring the chin slightly back to open the back of the neck, and suddenly the brain is much smoother. You can concentrate, you're not daydreaming, etc. Okay, so points that relax the frontal brain, that send the brain backwards, are not just do 24. Do 24 is called Shenting, but actually it's the whole frontal hairline. So that includes gallbladder 15, gallbladder 13. It's not just do 24, and it even includes stomach 8. Okay, Sanjiao 22 is called, very interesting name, it's called He Liao. Okay, He means harmony. What are we trying to do with our harmony? We're always trying to create, with acupuncture, we're always trying to create harmony. This is the only point in the body that has that character, harmony, in it. It's kind of interesting. We keep talking harmony, 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 and only one point has that name. And bladder 2 also sends the brain back because it affects the eye. It's better than using bladder 1, let's put it this way. Okay, maybe bladder 1 would have done a better job, but who wants to know? If the moment you approach with a needle to bladder 1, the brain's already activated way too much. Okay, and then what I call the correct tendon area. So that's the bladder 60 to 58 area, gallbladder 39, and here's a picture of this area. And you can see that this whole area has character the points have characters that have to support, to receive the weight, and yang to push things up. Okay. Now the actual so-called correct tendons, okay, which is actually the central ancestor and the sinew ancestor. Okay, they're they're not really correct tendons. So I'm sorry, correct ancestor and correct tendon. Okay, so they're not both correct tendons. One is a slightly different name, but there's a pair of these 2 points in red. They are tongue points that are called correct tendons, and they're famous for treating the back of the neck. Okay, and I'm saying that this whole area of the bladder channel, almost up to the knee, does the same thing. Okay, you don't have to use these points, which are, by the way, on the Achilles tendon, not terribly comfortable to needle or to receive. Trust me, they can be painful, even with a very thin needle. So now we're looking at making sure that the spine is free. Okay, because if the spine is tight, the organs can't work. Remember, this whole thing is about creating space in the torso, creating the connection between yin and yang before we move into the so-called 5 phases, which are the organs. Okay, so to undulate the spine, which will release the nervous system and activate the organs. Why? Because the shu points, shu is to communicate things, to move across things. Okay, so for the spine, the first thing I do is the sacroiliac ligaments and or do two upwards. Okay, why? Because the sacroiliac ligaments hold the whole structure of the spine. Okay, then I'm looking for the points in the spine where there's the largest curve or the largest shift in the curve. And those are usually T11, T12, T7, and T5. And then I try and open the spine outwards with small intestine 9-10 to needle towards the shoulder, the arm. And then finally do 15 or do 16 just to continue that lift into the brain, to give it an extra lift. Okay, so that's what I call undulating the spine. And practically every patient in my clinic, when I turn them over, they're going to get this treatment. Just about everyone, without exception. Okay, because it opens up the nervous system, even without diagnosing, without anything. It just allows for the whole system to suddenly work better. You're giving it more space. Okay. Now, when we're looking at the sacroiliac ligaments, I want to show you. Yes.
Can you just re-show your last slide?
Yes, it's there. Tell me when you're ready.
Oh, go ahead. Sorry, I forgot to change that.
All right. So when I talk
Abby,
about this,
can I just interrupt you for a second and go back
Yes.
to the slide before? Can
Here
you
we
just
are.
Yeah, thank you. Can you just clarify? So when you say small intestine 9-10, do you mean the space in between? So it's kind of like a
Yes.
9.9, so 9.5 we can call
yes.
it.
You can
Okay.
call it 9.5.
And then how about when you do T11, T12? Is that
So
the space in between as well?
Okay, no, that will be either 10, either 11 or 12, but it can be, okay, here's the problem. So it will, I use the Watteaus primarily, not so much to do. I'm not a big fan of the do channel for usage.
Watteau. Okay.
So I use Watteaus and I use, but wait. But my Watteau doesn't have to be below. My Watteau can be, level with it. I don't care. I'm looking for something when I'm sliding my finger against the spine, on the side of the spine. When I feel something puffy, like there's extra tissue there, that's probably what I'm looking at. So I'm going to go to just below that extra tissue, that extra puffiness, and I'm going to needle upwards and slightly towards the spine. So I'm trying to lift that gummy thing that's pushing down, that extra puffy thing that's there, and I'm needling it upwards and towards the spine. Okay, so it doesn't have to be below the, whatever they say, the vertebral space or whatever. It can be exactly level with the center of the vertebrae. It doesn't matter.
Okay, thank you for clarifying.
Okay, and it's either it's the level of 11, 12. It doesn't have to be exact.
Got it.
I don't care if it's 11. I don't care if it's 12. By the way, with 7 can be 8 or 9. 5 can be 4 or 6. Also, it's no big deal. And what you're looking for is you're looking for the places in the spine where there's a curve change that's fairly strong. Why? Like, you know, when you have a bow and arrow, okay, and when you're pulling, you know, the bow, you're going to get the most distance with the arrow if you pull the bow to the biggest curve. The bigger the curve, the more pronounced the curve, the more momentum there's going to be. So if I go in the spine and I go in a place where, well, it's all flat and it's like there's nothing happening, but if I go into a place where the kyphotic curve changes and is exaggerated, that's probably going to send a lot more vibration throughout the spine. If you don't do that, you might have to needle every single vertebrae to get things going. You're trying to minimize the amount you're doing to affect the full spine, to open the whole spine. Make sense?
Yes, thank you.
All right. So moving back to our slides.
Just
So
want to verify and be sure I, towards what you just said. So it's a lot of palpation, and let's say you find, do you sometimes use more points? Let's say in a case where you have these tensions all over the place, or in that cases, you go for these points?
You're talking about the chwai right now.
Mm-hmm.
Okay. You use what you can with the least amount, the strongest points that you can find that will affect the most that you can. It's always like that. Then if you can't, and you need to add, you add. But so the minimum for chwai, okay, is inner yin and mushu. That is the absolute minimum for it. I have a student who says he can use inner yin only and everything is fine. So fine, okay. I haven't seen the patients. I don't, but there's a good chance you'll need to do something before inner yin. You'll need to do some kidney point before. There's a chance you'll need spleen 3. There's a chance you'll need to release the throat. And also that's just the chwai. The thing is, don't go in and say, okay, remember the first thing, I'm creating a story. Chwai is a story. I have to now test the story, that strategy. I am not interested in just fixing the chwai. Okay, I am not an expert in usage of the legs. Okay, that does not interest me. I can be an expert in legs. Okay, I'm interested in fixing what the patient came for, and I'm saying the lack of use of the legs is contributing to your problem. Now, what I'm going to do is I'm going to test and see if my chwai protocol releases things in the abdomen and how much, and is it affecting your symptoms? Okay, so the chwai is no different than adrenal treatment or thyroid treatment or any other box that I put in. I'm just saying it happens to be a different kind of box because it's about creating the space. I'm just trying to give you a slightly different approach to things that is not so much about the 5 organs. Make sense? But the same kind of checking. Check what it does on the body and figure out what else needs to be done. So you're constantly, remember this looping between the story and the testing. I created some stories, possible stories. I'm testing each one to see how good it is. I'm dropping the stories that are useless. I'm keeping the stories that seem to work. Then I start needling. Then I'm going, oh, okay, the stories are not as good as I thought they are. Okay, let me try and make up another story and test another strategy. So I keep creating more stories, more strategies. Yeah?
Thank you.
You're welcome. All right. So these sacroiliac ligaments, and then we'll take a 5-minute break.
Might we take a pause?
Let me just do the sacroiliac
Okay.
ligaments, if that's okay.
Yeah,
Because-
that's fine.
and
Yeah.
We'll
thank
finish
you.
the subject. So.
Oh, it's great.
So the actual ligaments, you've seen this slide before. The actual ligaments are in this green area. However, it's very hard to needle into that area. So what I needle actually needle is on the red area, which is really from the iliac crest side. There's a lot more meat there, but you can see that the ligament itself, that's the gray area on the right side, that still gets the ligament. It just doesn't get it between the two bones. That's all. And you can extend it to the area below the iliac crest also, if you want. But your main point, the one main point that you're going to have is take bladder 32 and just slide outwards laterally, and you'll feel some gummy go a little bit up, a little bit down. You'll feel a big gummy, needle into that gummy. The angle you're trying to needle towards opposite gallbladder 26. Okay. But once you let go of the needle, there's a good chance that the needle's going to look like you needled it at 90 degrees, because those ligaments are very strong. They're going to pull, they're not, it's very hard to get, at that angle towards opposite goal, up and in. It's very difficult. So you're aiming at it, and chances are the muscles are going to
I
win.
just want to make sure you puncture up and inwards.
Inwards towards the spine and slightly up. So
Okay,
think
thank
as
you.
if towards Ren 6 or opposite gallbladder 26, either way. Okay.
And you do this with a one swim needle?
I do this with a one-swim needle, and I don't get the full needle in. I think that's perfectly
Oh, really?
appropriate.
Okay.
Yeah, I know. Yeah, listen, you can go in here with
Yeah.
tutsu, you can do lots of things here that are very, and if you want to go, I just don't see the need. I mean, why do I have to get between the bones and scrape the bone and blah, blah, blah? I mean, I'm making fun of it, but
Yeah.
it's like, I'm telling you, if you get at the top of the gummy and you puncture it a little bit and then just vibrate it,
Yeah.
it's going to send the vibration along. It doesn't have to be a steel needle that breaks it.
And you
Just
see
a
results
thought.
just as well.
In my opinion, yes.
Yeah. Okay.
According to my patients, yes.
Yeah, well, that's it. Yeah, through experience, like you said, right? Everything is through experience. So if you're
Yeah.
getting experience with one swim needle and you're getting results, then
And use, so I don't know what kind of needles you use, but what I would do is if you're using thicker needles, so if say you're using a number 5 needle right now, which is typical Chinese, number 5 is considered thin Chinese needle. Okay.
yeah, I use 30s, which is 30 millimeters. I do a lot
Yeah,
of
no,
muscle
30 is
too.
the length, but what about the thickness?
Yeah, point 30 millimeters.
Okay, that's pretty
Yeah.
thick. Okay.
It's
So
thick,
don't,
yeah.
yeah, I mean, I wouldn't touch a needle like that. It's
Of
like,
course not.
I'm like, oh my God, can't imagine. But no, it's fine. So if you want to go to a different style and start using thinner needles, don't go immediately to the number 1s, to the 0.18. Okay, move down to 22 or something, from 30. 30 is really thick. So move down to, you start with a blue, with what Sarin has as blue, as the light blue. I believe that's 0.22. And and then you see how much further, because at the beginning, it's very hard. Your hand is not used to the thin needle, and it's going to wobble all over the place. Okay, so you need to kind of train your hand to be lighter. Let me stop the share for, hold on. Okay. Oh, okay. This is not the end of the subject, but we're going to stop here. Oops, sorry. Stop the share. Okay. So what happens is you get used to not being so tight with the hand, and have the hand very light and directed from your chest, and then you can handle much thinner needles. It's possible. Now, I do want to acknowledge, I use guide tubes. I don't needle, without a guide tube. I don't try and get the needle in without a guide. There's no point. I don't see the point with doing that. I know for many people it's very important. So for that, some of the thinner needles are not going to work. The reds, the 0.18 are, is it 0.18 or 0.16? I'm actually not sure anymore what it is. I think it's 0.16. Actually.
0.16. Yep.
Yeah, 0.16. The 0.16 is the needle that I use. That you can still get in without a guide tube. Anything thinner, impossible, for me at least. Okay. The other thing is there's a difference between needles can be the exact same thickness officially, but totally different style needle. So if you're looking at a Japanese style, a Sarin, it's going to be very flexible. You can take the needle and you can do this with it. Hold on. So here's a sarin. And I don't know if you can see, but the needle is totally flexible. It moves. Okay. Chinese needles don't move. If you have a needle exact same thickness made in China, that needle is going to be tight. So people say to me, because I teach in Asia, and people say to me, you know, we're using the same same thickness needle that you are, but it's painful. Some say, I said, show me the needle, you know, and I'm looking at the needle, I'm going, are you kidding? This is like a knife. You know, the needle has no flexibility. The needle to me has to be flexible. Now, the Koreans are not as flexible as the Chinese, as the Japanese. Their dongbang is not super loose, flexible, but it's decent. It's acceptable. The Chinese, the stuff you get from China, the Wattos, the blah, blah, the blah, blah, it's great if you want to do Chinese style because they want a tight needle. I'm looking at the needle has to be like an antenna. An antenna has to move. It's receiving. So for me, a needle has to be flexible. Okay, and that takes different training in the hand. So move slowly towards a different type of needle if that's what you choose. So let's take a 5-minute break, and we'll come back at 20 past. Actually, I guess it's 18 past. All right. Thank you.
But, thank you, Avi.
So what I'd like to do now is I'd like for the next section to just not take questions in the middle because we're running a little bit late. And this next section is going to produce a lot of questions because there's a lot of Chinese going on and it's not so simple. So just trust that you'll get it. And I will take questions afterwards, but let me just get through the subject a little bit, you know, going first. Okay. So, sorry. So, yeah. Okay. So I'm showing you this sentence from the Heart Sutra, but it basically says, this is the Kuan Yin. She sheds light. That's the Jiao, as in Jiao Hai, as in kidney 6. Shed light on the 5 skandhas, on her body and mind, and she finds them equally empty. After this penetration, she overcame ill being. Ill being is this character, ku and e. Ku is something that's bitter. Okay, that's painful. Okay, and basically it's a grass that's old. When a grass is old, it's withering, it's kind of sinking, and it has no juice. And is distress, and you can see that the actual character is literally means a character, a person who's crouching under a cliff, which means that ill being has something to do with not being upright, not being extended, and therefore they don't have freshness and they're withering. Okay, that's what ill being, according to the Heart Sutra, is. And what's the antidote to ill being? The antidote to ill being is to shed light on your body. And who sheds light on the body? Kidney 6. It has the same character. You know, here it's Zhao Jian, okay, to shed light. And in kidney 6, it's Jiao Hai, shed light on the ocean. Okay. So then, okay, so we're seeing where did I get this kidney 6 from? Okay, where did these ideas come from? Okay, now we have, you know, in Ling Shu 33, it says that if you have lots of marrow, you will have this thing, Qing Jing Duo Li. You will have easefulness, you'll have you'll be sturdy, and you'll have lots of power, lots of strength. Okay, Qing, okay, easefulness is a very big thing. We all want to have ease. Okay, and so I'm now looking, normally if you say, what is the opposite of ease? Okay, we usually say in just about every language, you're going to say something in the negative. Like you will say restlessness. Okay, so in Chinese, it's the same thing. No peace, bu'an. Okay, is the opposite. Or, but technically speaking, okay, like in Buddhist texts, when you're looking at ease is a factor of enlightenment. Okay, If you're looking at the opposite of the mental formation called ease, Qing, you get this formation that's called Jiaoju. Jiao is to drop. I'm talking all the time about lifting. Drop the lift is what it says. Okay, is restlessness. Restlessness is to drop what's being lifted. Okay, so you can see why lifting is so important. It produces easefulness in our body. And the lift itself, character for lift, comes from like two hands squeezing together to extend something. This is where this idea of this gallbladder 30.
You mind repeating your last with your
Yes.
the hands there?
You have two hands coming from the side, coming together. Sorry, let me stop the share so it'll be a little bit easier to see. Okay, so you have two hands coming from the side in, kind of squeezing. That's your side gallbladder 28, the Mushu point. Squeeze to elongate. Okay, that's the purpose of that point. Okay, because, and you see it in the character when something is dropped. Let me get back to the share. Okay, when you see that this character to drop, of lifting, sorry, when the lift itself has something to extend. You see this character to extend Shen, like in UB62, okay, the extended vessel. This extension, I know it looks like as if it's centered with an extra stroke. It isn't. It actually comes from like two hands that are squeezing together to extend a rope. Okay, so ease is when we have a lift. Ease is when we're extending ourselves, when we're opening and hollowing. Okay, and ease is an absolute essential part of any kind of healing. Nobody gets better if they're all tight and uptight. It's just contradictory, right? So it just makes sense. Okay, so you can see where, you know, like how I'm coming up with points to, and then I'm testing them, of course. This is all nice theory. You know, it's a whole bunch of Chinese characters and it looks great on paper. It has to prove itself on the patient. Okay, and in this case, it does. Okay, the last thing that we need to do, and we do it on the back, so that's why it becomes kind of last, is make sure the circulation is going. Okay, so that's basically looking and making sure that both the heart and the lungs are clear, that they're operating. So what will happen is you want to needle bladder 42 or 40 towards, and 42, 43, 44, 45, the inner border of the scapula out towards the scapula, and add moxa. Small intestine 9-10 opens the chest. And support it when you're opening the chest, support it so that the waist, the kidney area, is consolidated with bladder 52 towards the spine. And then you can also surround small intestine 11, and I have a picture of that next. That's small intestine 11 on the left side, surrounded with the ashes of the ocumoxa. Okay, so these things here, these 7 principles, we want to address all these 7 things before we ever, you know, I'm going to say dramatically, before we even address the organs. Now, it doesn't mean that I have to do this treatment first and then wait a week or something. It all goes together. But one of my the first things I'm looking for is, does this person have Chwai? How tight are they in the neck? How tight are they in the diaphragm? How tight is the spine? Is the circulation open? Is the cardiac and lung circulation open? And do I need to relax the brain? And the answer on all these 7, on most people, is yes, you need to do them all. Most people, not all. Okay, so this is something that's somewhat separate from the style, and you can just take these principles and apply them doing anything in any way you want, with massage, with whatever. Okay, with words, you can instruct people. Let go of your neck. Relax your diaphragm. See if you can feel your perineal floor. But it's important to give them these concepts these steps, it's really important that you give it to them so that they can heal. Okay, that's the end of that. Let's, any questions on that? No. Okay. Okay. So,
Abby, I have
yes.
just a really interesting comment, more than a
Yes.
question. So
Okay.
you know those like tooth fairy points
Yes.
that you brought up?
You're
It's
a little
really-
further back. It's not on the throat. It's
Oh.
under. You're really kind of going under the teeth. You're not. It's not level with REN 23. It's
No. Up here,
yeah, and press up towards the teeth.
up towards the teeth.
Do you feel? Oh, go a little forward. Go towards the chin a little bit.
So I'm at the chin now,
Okay, go slightly out.
slightly out.
A little too much. You went too much.
Okay, slightly out.
Okay, and press up. On the inside of the teeth, press
On the
up.
in- okay.
Go inside your teeth and press up. But you had a different comment, so don't let me stop you.
No, I'm glad that you corrected because I was more in the belly of the muscle, and you seem
There's
like
still
you're
a
more on the
muscle there.
ridge. Yeah, but it's closer to the bone, to the
Yeah.
jawbone.
Okay.
Yeah. Okay.
So what were you
so-
feeling?
This area in my body often will just spasm. It'll
Mhm.
contract and spasm, and I have to relax it to release it. And I never understood why until today.
Okay, so see what happens when you grab your perineal floor and see if that relaxes it.
Yeah.
I mean,
Well, that's what I'm going to start doing. I'm going to
Yeah.
start noticing if I
experiment.
do these exactly, because I like it literally gets stuck, and I'm like, what am I doing with my mouth or my neck that happens, that gets triggered.
Yeah.
So anyways, I just wanted to comment on that. Thank
Yeah.
you.
You're welcome. All right.
Yeah.
Anyone else? All right, so let's move on to our official today's subject, which is pain. And let me get the slides for that. Treatment, this is not the right one. It should be the, oops, hold on. It's this one we're starting with. Okay, so before we go on to pain, before addressing pain, we need to address the patient's underlying constitution. So this is the whole class of yesterday. What might be holding this person back? Why is the pain pattern being continuing as opposed to just dissipating? Does the person have circulatory problems, endocrine problems, nervous system problems? The immune system is not working well. Is there a structural balance before they had this injury pain problem? What is holding them back? Can I address that? And if I address that, will the pain now go away? Then sometimes the pain goes away totally. Sometimes the pain goes away a little bit. Sometimes it doesn't even go away at all. Only after I address the constitution am I going to actually try tricks for the pain. So most of today is going to be tricks for the pain, for the knee pain, for the shoulder pain, for whatever. But before you do that, you have to address the whole body. Now, this idea that the body reflects in different places, that the fascia reflects in different places, is not unique to me or to Kiko or to Japanese or whatever. This is standard Western medical stuff. You can see that their map is a little bit different. But do take that into account also. Okay? Now, as I'm looking at, so I'm saying, okay, I'll treat, I'm not the kind of person who says, I'm going to treat the constitution. I don't really give a damn why you're here. I am the doctor. I am treating the constitution. I am superior. No, I'm always considering what you're here for. The most important thing is not that I treat the constitution. The most important thing is that I treat the problem you came here for, and that I did it well enough so it stays, so that the results last. Okay, so in order for me to do that, that's why I'm treating the constitution and the whole body, not because it's more interesting for me. It is more interesting for me, but the reason I'm doing it is for your pain, not for me. Okay, so I'm taking into account looking at the symptoms. If you have left-sided symptoms, especially in the neck and the shoulders, I'm going to start thinking, does this person have heart issues, cardiac type person? Maybe in their parents, maybe themselves, but I'm going to start asking questions about it and check the body to see if they have a cardiac presentation. If they have right-sided symptoms, I'm more likely to think, wow, maybe something's weird with the liver. Let me check that. People who have thyroid issues will tend to have neck and shoulder problems. Okay, it's just the nature of, because the thyroid is here. Okay, so they're going to have problems with around the SCM, the cervicals, gallbladder 21 area, you know, the upper shoulders, not the lower shoulders, not UB43 kind of thing. Okay, but because of the thyroid, they have there's a weakness in the whole neck and throat. Okay, then always look for some of the essential elements, things like autoimmune disorders. Are they sleeping okay? What is their blood pressure? What is the state of the autonomic nervous system? Do they have fibromyalgia? Do they have adrenals or thyroid? Is there diabetes or sugar imbalance? And check 5 points. So this is like, you know, kind of a short list that's kind of minimal. At least I want to check that, okay? And address it if it's there, okay? So we're going to very quickly, basically it's a review. If they have a named autoimmune disorder, they tell me, I'm not telling them. I'm not checking on the body and saying you have autoimmune. They say I have a problem. I treat the kidneys and the lungs. So on the front, it means kidney and lung points. On the back, it means bladder 13 or 42 and UB23 or 52. If they have rapid pulse or normal pulse, I can needle rent 4. Otherwise, I have to do Mushu, side gallbladder 28. Slow pulse, UB27, the sacroiliac ligaments is most important. There's a possibility that autoimmune disorders will show on the mastoid outside of gallbladder 20 or even on DO16. It's possible, but don't rely on it. If they have sleep disorders, people who don't sleep well are going to feel more pain. It's just the nature of it. So sleep disorders can reflect on REN 17, REN 15, bladder 17, that's the autonomic nervous system shoe, right? T5 through T7, and the occiput. The occiput is the anmien, the good sleep area. Okay, so generally for sleep disorders, we treat the spleen and pericardium combination. So the first one I think about is spleen 3 plus pericardium. What does it mean, pericardium? Check pericardium 8. Pressure pain on pericardium 8, do pericardium 3 and 5. No pain on pericardium 8, use pericardium 4, 3 fingers below 3, or if you really want to, use pericardium 6. That's fine. Okay. Other spleen pericardium combinations are the blood pressure combination. Spleen 6 plus 9 plus pericardium. So we have a number of spleen pericardium combinations. The reason it's so important is because the spleen, like I said yesterday, it's the yi. Without the yi, without the awareness, there can be no problems. The problems come because we have awareness of them. Otherwise, yeah, maybe other people think I have a problem, but I don't have a problem. So the yi is always involved. So it's important. Okay. And Shimyan means is a sleep point. Also, it's at the center of the heel. And that's primarily, it's a moxa point for me, direct moxa point for me. You could needle it, but people kind of don't like it. And you can think of that as the equivalent of doing yin chow, yang chow. Like the yin chow, yang chow meet at the center of the heel. And they meet at bladder 1, allowing you to sleep, is how the Chinese express it. Okay. And then I do bladder 17, which is the autonomic nervous system shoe. Okay. Now, I don't have to do bladder 17. I might do T7 instead. Okay. But that's trying to address the sleep disorders. I'm keeping in mind they have pain and they have sleep disorders. I need to deal with that. They might have blood pressure issues, either high or low or unusual blood pressure. And the treatment for that is spleen 6, spleen 9, plus the pericardium, whatever you choose, plus under the third toe, and small intestine 9-10 to open the upper back. okay, and allow good flow of circulation. Okay. If they have an autonomic nervous system disorder, which I might see through the SCM, or it might show on REN 17, 15, or REN 9, and they may have tightness on liver 12. The treatment for that is Sanjiao 8, I'm sorry, unless they have rapid pulse, in which case Sanjiao 5 will do a better job. Do 2 on the back. Under the third toe, if the pulse is tight, meaning it's thin, wiry, and disappears on pressure or changes quality on pressure. And possibly spleen and pericardium also. Okay, but I try to separate the categories a little bit, but they do intermix. People have fibromyalgia, okay, it will show on the scalenes and treat the spleen 3 and the stomach chi points, those bump along the stomach channel, just lateral to the bone. Touching the bone, there's bumps. Kneel them down and in towards the bone. And you can do 2 or 3 on each side. And also for fibromyalgia, make sure that their adrenals are in good shape, the liver is in good shape, autonomic nervous system, that they're sleeping, okay? And treat those if need be, because fibromyalgia can be a result of any of those also, or can involve any of those, okay? So this is all review.
Avi,
Yes.
just a quick question about the stomach chi. When you're talking about the points along the shin, is that it? So from like 36 down towards 40?
Yeah, usually more, no, from 40 down to 41.
Oh, thank you.
More. I mean, it can be
Okay.
below 36, but generally they're lower. Okay.
Okay, thank
Now,
you.
this area, okay, so so stomach 37 and stomach 39, I believe, they're the lower head points of the small intestine and the large intestine. And there are also points that are called they are the Sea of Chong, the Sea of Blood points, right? Okay, so yes, that area counts also, but also below it. It basically the assigning those points, those 2 named points, 37 and 39, as lower hair points, and as points on the Sea of Chong, suggests that whole stomach line is very important. And generally speaking, you're going to find more of those bumps, which is an interference with the channel, meaning if there's a bump, it means the channel isn't smooth. You're going to find more of them below stomach 39 than above. You might find above. I'm not saying you won't, but you'll find more below, generally speaking. Okay? So adrenals, you have to treat in pain, and it can show below kidney 16, the 4 o'clock, 8 o'clock. Adrenal person may have kidney 2 pressure pain also. They may show right side stomach 27, and they might have valley back when they're lying on the belly. The spine is inside these tight muscles. It's like it's in a valley. Okay, so original treatment is kidney 6 and kidney 27. But if you have kidney 2 pain, you will substitute and do kidney 7 and 10 and 27. And you might, for various reasons, choose, for example, kidney 9 and 27. So it's a kidney point below the knee plus kidney 27. That's adrenal treatment. If they have thyroid issues, they will probably show pressure pain on the lower part of the SCM from stomach 9 and lower. And you need to treat the kidney channel. Usually for me, it's kidney 7 or 9, but it might be kidney 3, which is officially the best point for hypothyroid, but in my opinion, it's not. Again, you might treat the stomach chi points. Lung points might help. And for hypothyroid, again, it's that activation, the undulation of the spine. Do 2, T11, 12, T7, and T5. The points where the curve changes the most. Okay. If they have a sugar imbalance, which includes diabetes, you're going to look at spleen 3 and T11, T12. We call those sugar points. You're literally looking for puffiness around T11, 12. Almost everyone has puffiness around T11, T12. If they're actually diabetic, then to that you also add the adrenal treatment, the immune points, and the OD. Okay? And note that people who have sugar imbalances tend to be more susceptible to muscular pain on the left side. Okay, that's not 100% like that, but there's a tendency for that. And finally, we want to check the fire points. When there's a fire point on any channel is painful, we treat the metal and the water points of that same channel on the same side. The exceptions are these. For the small intestine channel, I tend to treat heart 3. For the heart channel, I will tend to treat small intestine 9-10. Okay. Now, the reason why this fire point diagnosis is important with pain syndromes is, let's say you have sciatica, and the sciatica is on the gallbladder channel. You release the piriformis, you did everything, and then you go, well, there's still pain. I wonder if gallbladder 43, 44 will help. These are the metal water points of the gallbladder. Okay, so sometimes
you mind repeating your last?
Sure. So you have sciatica and you did everything you could to release it. The sciatica is on the gallbladder channel, let's say. Now you're checking, does gallbladder 43 and 44, okay, the metal water points of the gallbladder channel, are they going to help the pain? So if it's sometimes we apply the metal water for pain, even if the fire point is not showing yet. Okay. So, and if they have gynecological issues, consider that, because someone who's had fibroids, even if the uterus is removed, but if somebody is a fibroid or a cyst type, liver 8 is going to be a very important point for them. And it's going to help with whatever pain they came for, even if it's shoulder pain. And endometriosis, liver 5, direct moxa is a very important point for that kind of person. Okay, no matter what other pain they have, those points are going to work for those people in all likelihood. It may not take it away 100%, but it's important to address that because it's an underlying condition that's holding the pain pattern. Okay. Now, before you address the actual pain, so we're doing that, we're addressing the constitution, we established the space in the body, we're addressing the constitution and whatever organ is problematic for them, etc., etc. And now we want to come to the pain. And now, by the way, this all happens simultaneously, but it's just in my way of thinking, it's one after another. It all happens at the same time. It all gets mixed up, thrown into the mix. So if they have joint pain, I'm going to look at spleen 9 as a major point for them because joints belong in the spleen category. If it's a ligament pain, a tendon pain, I'm going to consider liver 8 or liver 4. And yes, I am not considering gallbladder 34 necessarily. Okay, gallbladder 34 is not.
Just a second. I am sorry, I lost a
Yes.
little bit the signal again. Can you repeat almost from the start, but I'll be fast translating.
Okay,
On this slide.
Okay, so if they have joint problems, spleen 9, because joints belong in the spleen category. Tendons or ligaments is liver 8 or liver 4, but not so much gallbladder 34. Gallbladder 34, I know, is the master of tendons, but it actually means something else. It's the master of torque. When a tendon is torqued, that's when gallbladder 34 is a good point. Okay, if you think of yourself as like when you go skiing, gallbladder 34 constantly gets activated as you're twisting around, moving around. Okay, so that's torquing, twisting and torquing. The ligaments themselves, to relax the ligaments, we're talking about blood, liver blood. That's liver 8 or liver 4. Gallbladder 34 is a great point for the sacrum. Okay. If the pain is in the bone, think of kidney 7. If the pain is muscular, think of using spleen 3. If the pain feels like a bruise, think of using the OD point, right side stomach 22. Pain that's deep tissue, deep in the tissue, I will think of using liver 13. Pain that has to do with medications, for example, people who are taking lots of medications, opiates or stuff like that, or they take lots of medications and now they have weird pain, use the detox treatment, kidney 9 and large intestine 15. Now, I do have another kidney 9, which is actually 3 fingers below kidney 10, a different kind of kidney 9, specifically for opiates. Kidney 9 is detox for everything else except, possibly except opiates. Sometimes with opiates, you see that kidney 9 is not as effective, so you can try 3 fingers below kidney 10. So you know kidney 9 is at the base of the gastrocnemius from the bottom. But then if you go from the knee downwards, there's going to be the mound of the gastrocnemius doesn't start until about Tutsun below the knee. So that's the other kidney 9. Okay. Now, here are some popular points that I use for structural issues and pain. Anything to do with twisting, so that can be shoulder pain or back pain or knee pain, you twist it around the torso. That, or often when people lift something heavy, they don't lift, nobody lifts just straight up and down. Usually we turn around a little bit because it's easier to lift something heavy if we give it a little bit of a torque, a little bit of a twist. That's a gallbladder 26 type thing. Okay, so they'll have pressure pain on one side, gallbladder 26, release that with kidney 7 first, and then needle gallbladder 26. Anything to do with when I'm standing or something to do with my posture, okay, think of stomach 41. Now that also includes like sitting for a long time is problematic for me, okay, that might be stomach 41. Anything to do with bending or stretching or anything to do with the spine, think about the sacroiliac ligaments. Anything around the spine, any spine problem, okay, pain, look at T11, T12, and T5, as well as do 2. Now, here for example, it's very common people will have pain. So yes, of course, mostly they come with L5. Okay, but say they have pain on T5. See if T11, 12 resolves T5. Okay, so it's just giving you places in the spine that can affect the whole spine. Related to bending and stretching is stomach chi. And stomach 41 and stomach chi are closely related. The bumps and the actual point stomach 41, you know, you can use a combination of both of them. Okay. Use the occiput to treat the spine. And it means do 16, but also outside of do 16. Very good for the spine. Use bladder 2 for the neck and for the diaphragm, as well as for pain perception in general, to relax the brain. And here again is gallbladder 34 as for torque. Okay, when something is torqued, I use gallbladder 34. Now, the places where we have the most torque, the sacroiliac ligaments, for example, get torqued all the time. So I'm always using gallbladder 34 to release the sacroiliac ligaments. In the wrist, often we have torque because it can move around a lot. So I'll use gallbladder 34 for wrists. Okay, and then don't forget inner yin to allow for the whole core to hold. Okay, so it's very important because if the core if there's no awareness of the core, the whole body is like falling down and the pain is going to feel a lot stronger. So inner yin officially is a good point for the trapezius. Okay, big deal. So lots of people have trapezius pain, but I use inner yin for everything else, just because it helps establish that perineal lift. Okay. Now, here are some points that it is said that they release endorphins, bladder 2 and the center of the heel. Then to relax the brain, okay, use the whole frontal hairline, do 23, 24, all the way to stomach 8. And also that includes gallbladder 13 and 15, and you can go all the way back on the gallbladder channel to gallbladder 17. Okay, gallbladder 17 is called Zheng Ying, which basically means something like terribly frightened, shocked and frightened. Okay, so when when you're freaked out about something, your pain is going to be much stronger. Okay, and it's an area of the brain, it's above an area of the brain that is responsible for pain and fear perception. Okay, especially on the left. So gallbladder 15, 16, 17 are very good for pain. Okay, and then you have a whole bunch of scalp maps. Yamamoto scalp maps, Dr. Zhu scalp maps. There's a whole bunch of scalp maps. However, I'm suggesting don't use any of these points until the very end. And the reason why is because if you're affecting the brain too fast, you're not going to be able to find, the brain's going to say, oh, everything is happy, I'm good. Okay. And then you're not going to be able to ascertain which points on the body, which other points you want to use. So use the brain trick at the very end. You've done everything you could to correct whatever you wanted to correct. And now you want to relax the brain and give them some pain relief. So it's a little bit like, say you had some injury, you do your physical therapy, you do the exercises, and you also take painkillers. This is a little bit more like the painkillers. And the other acupuncture is the actual, okay, let's fix the problem. Let's make those muscles stronger. Let's correct the imbalances. These points are, quote unquote, a little bit more symptomatic. They will get the person out of pain to some extent. And that's a good thing, but they're not necessarily fixing the problem unless the problem is totally a perceptual problem. Okay. So my suggestion is at this point, we'll take a 10-minute break. So let's see if there are any questions and take a break. So any questions?
I have a question.
Of course.
Yeah, of course, always. I can't help myself.
It's okay. It's okay.
There's lots of material to digest.
Keep going. Let us know what the question is. It's okay.
Okay, so this is regarding, it's personal because it's a client of mine who's on heavy amounts of opioids for 6 months now.
Okay.
Okay, and he comes with manifestation of pain occasionally at large intestine 15.
Okay.
He also recently had a knee surgery around kidney 10. And so it's just interesting to note that these
Why
2
would
points,
he have a kidney? Wait. What's the surgery around?
he had
kidney 10 for?
a meniscus
That's
tear.
That's not kidney 10 area. That's a little. That's much more towards. I mean, it's lateral to spleen 9. It's above, but it's not. Kidney 10 is in the back.
Kidney 10. Well, at the knee. Sorry, the medial. We'll just call it the medial aspect of the knee,
Fair enough.
for sake of argument.
Okay.
And also manifestation of pain at liver 15.
Large intestine 15. Okay.
Sorry, large intestine 15. Yes,
Yes.
thank you.
Okay.
Yeah. So when you say that you treat for opiates, is this something that can
It
help
might be. You
relieve?
can try, but of course you try and you see. I can't tell you right away, but I'm going to have a little lecture on large intestine 15. You'll see, but basically, what are the opiates for originally? What's the original?
Cervical pain. He has herniated discs.
Okay, so what I would do is first, so let's take that as a case study. So what I do is I look at the medical history and, I don't have all of it, but let's take what we have. So there's a neck cervical problems, and I'm assuming they did surgery and didn't solve the problem. And so now he's on these opiates. I'm just guessing, but it doesn't have to be that way. The first thing I'm interested in doing is address the original pain issue. Okay, right now, this is the first medical history. There may be other things that we don't know yet about. So I'm going to look at how can I fix the neck? It's a bone issue, so it's a kidney 7. It's the neck, so it's a Sanjiao 8. Remember, we had that basilar artery insufficient phenomenon? Okay, so I'm looking at kidney 7, inner yin, liver 8, and Sanjiao 8. And then see what else happens. Sanjiao 8 is also going to relax the nervous system. Then because it's the neck, I can look at bladder 2. It affects the neck, the small intestine channel especially. Bladder 2 also is a good calmer. Okay, so I'm looking at now, I can say, by the way, now it's all complicated with all these damn opiates. So I can also look at, but I cannot needle large intestine 15. What I'm going to do is I'm going to check if large intestine 15 gets, after I've done what I've done up to now, does it affect large intestine 15? Will maybe now adding kidney 9 add a little bit more to large intestine 15? And now I can address large intestine 15 specifically assuming now I've addressed all of the medical history, which I don't have, so you will do more according to what else there is in the medical history. Then I'm saying, okay, what's left in large intestine 15? What's left in with a meniscus? Now, meniscus, basically stomach 41. Okay, yeah, just kind of like, just assume it's probably going to be stomach 41, same side, most likely. Also check his gallbladder 26. I don't know if the knee is the same side as the large intestine, but you know, you have a knee problem, you have a shoulder problem, maybe the connection between them, gallbladder 26, is weird. Okay, so that's something else to look at. You already have kidney 7, not for the gallbladder 26, but for the bone. You see, things add up and they support each other. Now, for the large intestine 15, what you're going to look at is probably lung 5 and or immune. Okay, on the front. So that's kind of like, you know, so if you ask me that, this is what I would throw out to myself as doing. I would have a little bit, because I would see what the medical history is, and I would be able to say, oh, and by the way, you know, you have this disorder. I mean, is this rheumatoid arthritis that affected the neck? That's an autoimmune disorder. Okay, I have to throw in REN4, blah, 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 blah. Okay, but that's how I work. I just keep churning it out, kind of thing, and see what I can do. Now, on the back for large intestine 15, there's a good chance, I can't guarantee it, there's a good chance that the inner border of the scapula, UB42, 43, kneel towards the scapula will help it. It's better for deltoid than large intestine 15, but large intestine 15 is on the deltoid, so it could still work. Okay, and small intestine 9-10, which is a point that's part of the autonomic nervous system, but it's also a great point for shoulder. Okay.
Thank you.
You're welcome. Any other questions? All right, let's come back at 10:08. And we'll continue, because now basically what we're going to do is, oh, you're welcome. We're just going to, the next section is just going through all the different parts of the body and how to treat pain in different parts of the body. So it's going to be a fair amount of overwhelm. It's going to be a lot of lists of points. Just be aware. Okay. So I'll see you in 10 minutes. Okay. So the sacrum, let's look at the sacrum. I'm doing the sacrum first, partially because, well, back pain obviously is a very common thing. And in order to treat back pain, I'm using the sacroiliac ligaments. So before I use the sacroiliac ligaments, I have to make sure that there's no pain on them to begin with. The other reason I'm starting with this is because, first of all, it's part of the core, just like we saw before when Carl was saying, oh, but I can get lordotic. And I said, no. If you relax the sacroiliac ligaments, if you allow the space in the sacrum, a lot of the patterns that you get disappear. Okay, so this is a very strong, very important part of the core. Okay, now the other reason I'm choosing to do it first is because it's so central. The sacrum is so central. This is the one place I do not needle. Except you saw Sanjiao 8, I needle opposite side to the SCM. But I told you it also does the same side. Generally speaking, I don't do a lot of opposite sides. And I also don't do so much in the sacrum is the only place where I'm actually going to take the sacroiliac ligaments on the opposite side and needle those. Okay, so if you have right side sacroiliac ligament pain, I will actually needle the left side sacroiliac ligament, as long as it's okay, as long as that one doesn't have pain. So it's the only place I can do it because it's a direct correlation. It's the only place in the body that for me feels it has that direct correlation. Okay, so the sacrum. The sacroiliac ligaments have a major effect on bending and stretching. The same thing as like the stomach chi points do. Okay, and they affect the whole spine. And because of that, they can affect things that don't seem to have as much connection with the sacrum, like, you know, shoulder pain, for example. Sometimes needling into the sacroiliac ligaments releases the shoulder. Okay, it can happen. It happens actually often enough. Okay, so they're very central because they establish the capacity of the core of the body to feel supported. Okay, so if you have sacroiliac ligament problem, I use gallbladder 34, same side, but opposite, same spot exactly, but opposite side, okay, of the sacroiliac. I can also use kidney 6 with UB62. And originally, this is an iron pumping treatment. That's why you have the black clip on kidney 6 and the red clip on UB62. This is the same side as the sacroiliac that is hurting. And if it's the whole sacrum, then use it on both sides. Kidney 6 and UB62. And the cord, if you are using cords, the cord of kidney 6 on the left goes to UB62 on the left. Don't pull the cord over to the other leg. Okay. And then under the mastoid can help the sacroiliac. Okay. And be aware that sacroiliac issues can reflect autoimmune disorders. People with autoimmune disorders often have very tight sacroiliac ligaments and like ropey, almost like ping pong balls in there. Then the sacroiliac ligaments are also affected by anywhere from small intestine 12, small intestine 13, or again, small intestine 9, 10. It's affected by the scapula. And in a moment, I'm going to show you different ways to try and see the connection between the scapula and the sacrum. It's actually more the scapula and the ilium. Okay. If somebody has puffiness on the sacrum, it happens sometimes. Okay. That, you know, like you're trying to find UB32 and you go, wow, it's so puffy here. Okay. It's either because they fell on their tailbone and they compressed the sacrum and now it's puffy, or it can be, with women, it can be hormonal issues. Okay. So the sacrum and the scapula, and like I said, it's really more the iliac and the scapula, because this the iliac and the scapula, because the sacrum should be the spine. Okay, it's in the center, but that's not quite how it works. But you can see, just from the visualization, you can see how both the scapula and the iliac bones have this hollowness to them. And they kind of reflect each other, and they also have spines, sort of thing. There are bones that are similar. So you can do different mappings on it. And I'm not going to go through this slide because it's just too much verbiage. Okay, but I will show you pictures that you can see. So you see the red areas. Okay, so if we're saying the sacrum is the spine and the scapula is like the iliac, the sacroiliac should be officially close to the spine on the scapula. So that will be the inner border of the scapula, because that's between the scapula and the spine, just like the sacroiliac ligaments are between the spine, the sacrum, and the iliac bone. You can also see that both bones have a spine. So you can say that the superior iliac crest, the posterior iliac crest, is the same thing as the spinous process of the scapula. Okay, and if that's the case, you can see what's next to it is that superior fossa, which is where small intestine 13 and 12 are, and that can become the sacroiliac ligaments. So you just have to keep looking at it and see different possibilities. So I'm going to give you another picture that will just give you a slightly different angling on it. So you can see how there is a reflection between the two bones. Okay, and it all depends on which way you want to rotate it to see what part of the scapula is going to help the sacral part. So some people, it will be small intestine 12 will do a great job. Some people, small intestine 13 will do a good job. Some people underneath small intestine 12, meaning under the scapular spine, will do a good job. That's the same as the lymph node treatment point. Some people, small intestine 9, 10 will do a good job. Some people, UB42, 43 will do a good job. It's hard to tell exactly where in the scapula for a particular person the scapula is going to help. So you're going to have to kind of like find out. Start with small intestine 12, 13, and and keep trying a few others. If it doesn't work, then okay, the scapula didn't do it. But be aware that there can be a few points that could still do the trick. Okay. The spinal problems. So I always start treatment with a patient lying face up. So, even though they want to lie down face down because I have a problem in my back. So on the front, I start looking at REN 12 is an important point for spine and marrow and neurological problems. I look at spleen 3. Spleen 3 has the character for rising, moving things up the spine. Heart of soul is a point. It's basically, many people will say that's kidney 1. Okay. I tend to think of it as a little bit more towards the toes than kidney 1, but you basically.
Can you repeat your last about the heart of soul?
Okay. Heart of soul, some people will say this is exactly the same as kidney 1. Sorry, I don't have a picture of it. They will say that it's kidney 1. Okay. So if you take kidney 1 as 1/3 distance, heart of soul will be 1 sun more towards the toes. Okay. It's where if you're sliding from the heel towards the toes, it's where the arch of the foot kind of has a dent in it. That's heart of soul. Okay. So for me, kidney 1 officially is a little bit more towards the heel. But either way, no big deal. It's 1 sun difference. Figure out the point that helps the spine the most. Then the sacroiliac ligaments are most important for the spine. They stabilize the whole spine. Do2 is very important for spine. And then the big curves of the spine, I keep saying that all the time. And you can use one for the other, meaning if you have T5 problem, use T11-12. If you have T11-12 problem, use T5. And use both of them for all the other areas in the spine. Gallbladder 39 is a good point for spine. And I usually would add 16 to it. Large intestine 16 can be a supporting point for the lower spine, for L4, L5 kind of area. Okay, it's a supporting point. The name of the point is called gigantic bone. So someone has decided that because it's named gigantic bone, it is supposed to be a point on the Sea of Marrow. But classically, it is not. That's a Vietnamese addition. Okay. And because I decided to test it, I can say that large intestine 16 supports treatments for the lumbar spine, but it's not a major point. And we talked about the 4 corners before. That's small intestine 9-10 and Yao Yan, the lumbar eye. So it's like stretching things out in 4 directions. Okay, to open up the spine. Now, more specific, if you have tailbone issues, use lung 8, bladder 66, Watto of C71. So you might use all 3 of those. You might use all 3 of those on both sides. You might just use 1 point on one side. It's hard to tell which one's going to do it. Okay. Now let's get more specific. L4, L5, your main point is spleen 9, but also kidney 7. Okay, spleen 9 gets needled flat to the skin upwards towards inner knee eye. And then if it's one-sided L5, use heart 3 also. Okay, if it's both sides, heart 3 is not going to touch it. Heart 3 is related to twisting, one-sided stuff, whether it's on L5 or whether it's on C7. Okay. And then you do the sacroiliac when you've turned them open, because the sacroiliac will probably totally eliminate the L4, L5. That's really your trump card. Okay. Lower back in general. So if they're saying I have pain across the PSIS, the posterior superior iliac spine, that's sorry?
I have a question towards the sacroiliac.
Yeah.
When you do those points, I understand very well the place of the palpation in the Japanese approach. But do you sometimes put more than the needle if you feel more toward, or you try to just use one on the sacroiliac?
Oh, the sacroiliac you can use. Okay, so you can use 2 or 3 or even 4. Okay, usually what I do is I take bladder 32 and I just slide my thumb outside, and I find the gummiest spot. It's usually at the level of UB32, and I needle that. Okay, and then I'll do that on the other side. And then if I want to extract more, I feel like I can get more out of it, I'll find some more gummy points, maybe just on one side, maybe on both sides. And I could needle 2 or 3 needles on the sacroiliac. And remember, I showed you below the iliac crest, you can extend the area you're needling to below the iliac crest as well.
Thank you.
So you can get more than 1 point on each side. Absolutely. Okay. Now, generally speaking, if I'm needling the sacroiliac ligaments, I will needle both sides. I may have 2 or 3 needles on one side and only 1 on the other. But generally speaking, it's not a good idea to needle this, the sacrum just on one side, because you're shifting everything to one side. I like a certain amount of balance there, if possible. Okay. So back to the posterior iliac spine is related to immunity, so that's immune point. And because of that, someone who has, I have back pain when I arch my back. When you arch your back, you're contracting the muscles that are holding the iliac spine in the back. That's an immune point type indication. Somebody who says, when I'm arching my back, I get pain in the back. Okay. If they have pain on the quadratus lumborum, okay, that's, kidney shoe area, that's kidney related. And I use kidney 7 and lung 10. And remember that my lung 10 is not on the bone. My lung 10 is a little bit closer to pericardium 8. It's across from large intestine 4. So it's on the fleshier part than what TCM says. If they have very tight paraspinals, like the valley back, then I use adrenal treatment on the front. And then I also would look for sugar, because they're tight muscles, and tight muscles are related to sugar consumption often. And I would consider whether this is a hormonal presentation, and then maybe use UB66. Okay. Your lower thoracics, okay, if it's on both sides, it can be a sugar metabolism issue. Okay, so I use spleen 3 and the OD point, and then on the back, if I can at that point actually put a needle in T11, T12, I will. Okay, but if there's still too much tension there, I can't. And if it's right side only, it's likely to be liver. And then on the back, I would use the thing that affects it most directly is left bladder 35. Remember, left bladder 35 is the continuation of all liver treatments from the front on the back. On the back, I always use left UB35, and that releases UB18 area. On the upper thoracics, that's the area between the scapula. Yes.
C'est VB35 ou 35 vessie?
I need a translation for that.
It's gallbladder 35. 35, je m'excuse, c'est une erreur. Merci de l'avoir dit.
On mine, it says bladder 35. So somebody translated it as gallbladder?
Gallbladder. Okay.
Is it UB35? It's supposed to be gallbladder 35.
No, it's supposed to be bladder 35.
Okay, it's bladder 35. Okay, it was my mistake. I'm correcting with the French people.
Okay, c'est ça.
Sorry. All right. So, pain between the scapulas. Okay, so we talked about gallbladder 39 being able to open the chest, create the space between the legs and the torso. Okay, again, the 4 corners releases the rhomboids. Inner yin is a trapezius point, but it also releases the rhomboids. And again, always think of inner yin with any kind of pain presentation. Maybe you need to use inner yin. Why? Because you get the core established. If you get the core established, the pain, the whole body is held better. There's going to be less pain. Okay. Then Pain around small intestine 13, Sanjiao 15 can be hormonally related. Remember, that was one of the hormonal reflexes. So you may use UB66. You may use small intestine 3 for that. And note that there is a connection between bladder 15, that's the heart shoe, and bladder 32, which is a hormonal point. They connect. It's like the Baumai, the heart and kidney water-fire connection. So sometimes if they have bladder 15 pain, I might release it with bladder 32. And the opposite, if somebody has UB15 pain, I might release it with UB32. Okay, those 2 points seem to have a close relationship. Okay. If they have pain on the left inner border of the scapula, I relate that to the autonomic nervous system because of the pacemaker of the heart. I use DO2 because DO2 is my main point for releasing the nervous system. Okay. If they have pain on the right inner border of the scapula, I relate that to the liver. And I will use right liver 1 on the front when I do. And then when I do the back treatment, I will do left bladder 35. That's bladder 35, not gallbladder 35. Okay, the one that's just outside DO2. Okay. Then if it's trapezius, not just rhomboid, so it's a larger area kind of thing, what I will use for the trapezius is inner yin, and then behind the SCM, Sanjiao 16. I will actually needle Sanjiao 16 for trapezius pain. Okay, now if Sanjiao 16 is painful, I will release it first with the immune point. Okay.
With which point?
Immune. Release Sanjiao 16 with immune point because Sanjiao 16 is a reflex of immunity. Okay. So, neck pain, extremely important to resolve because it affects the whole nervous system and it's going to affect everything. Okay. So what you have in the neck, you have a point that's called stomach 9, Ren Yin. Okay. To welcome the human, the carotid body, okay, which is behind stomach 9, monitors and controls the oxygenation of the brain. There's the carotid artery kind of splits there, and that V of the split creates a situation where it allows, I don't know the physiology terribly well, and it's a big subject now with long COVID also, about the carotid body. Because that seems to interfere in people with COVID. Something in that split of the artery seems to affect the oxygenation of the brain. Okay. Then you have the SCM, which we keep talking about, that the SCM is so important because it affects the tone of the vagus nerve. The scalenes affect our breathing, therefore they affect our emotion. And the same thing we can say about C4. It affects the phrenic nerve, the diaphragm. So it affects the breathing and therefore perceptions of pain. So very important to release the neck in general, and especially if they have neck pain. Okay, so not just I'm finding that it's tight, but the person actually, the main complaint is something in the neck. Okay, so in any neck pain, the first thing you want to do is release the scalenes and release the SCM. Doesn't matter if that's where their pain is. The scalenes is because that's the blood supply to the upper body. Okay, it controls the brachial plexus, I can't pronounce it, but the plexus that supplies the blood supply to the arm as well as to the trapezius and upper body. Okay, that all flows under the scalenes. Okay, so scalenes we release with any of these: spleen 3, lung 8, heart 3, or inner yin, and you might use all 4. Okay. The SCM we release with opposite Sanjiao 8, or if the pulse is rapid, consider Sanjiao 5. Kidney 9 can release the SCM, and stomach 41, and that's on the same side. Okay, so any neck problem, first and foremost, look at the scalenes and the SCM. Then if they have this carotid artery phenomenon, carotid body phenomenon, use lung 8. Okay, so remember lung 8, the name is the ditches and the rivers. It has the ability to penetrate and oxygenate. Okay, and we're looking at stomach 8 as a point that controls the oxygenation of the brain. If they have pain around Sanjiao 16 behind the SCM, use the immune point. Gallbladder 21 specifically is a spleen 9 indication. But if it's slightly behind gallbladder 21, starting to be more like a back point, then use the jaw area to release the behind gallbladder 21 area. Okay. Then on the cervical spine, and we've done this all yesterday, but it's a repeat for that. The cervicals, we use Sanjiao 8, the same side, plus kidney points, excuse me, and liver 8. Excuse me. Then on the back, we will use Ihikon. Ihikon is UB60, UB58, and so-called UB40, but this UB40 is always more lateral, so it's really more like UB39, or possibly even UB38, which is a little bit above. I often substitute, instead of UB60, I often use GB39. Okay, gallbladder 39 instead of bladder 60 sometimes. Both gallbladder 39 and bladder 60, I needle upwards, flat to the skin upwards. The main point here is UB58. Ihikon, the main point is 58. Okay. Well, if they have C3 pain, I use, if it's on the right side, I'll use liver 1 on the right side. If it's on the left side, I either think it's a cardiac presentation and start checking cardiac possibilities, or if not, I'll just go with spleen 1. Okay. If they have pain on C4, I use stomach 9 in the front. If they have lower C5, I go to large intestine 18. And if they have C6 or C7 and it's one-sided only, remember heart.
Can you repeat? It's written, but you said something about Sanjiao 18. Am I right? Or?
Sanjiao 18, I don't think so.
Oh, okay, I'm sorry, I misunderstood.
No, it's okay. In which vertebrae are we talking about?
Atlas?
In the back
I haven't gotten to the atlas yet.
Stomach 9, you told us. Sanjiao 16.
No, I just misunderstood. Carry on.
Okay, not on this slide. There was no Sanjiao 16 on this slide, I believe.
Intestine 18 is what you said.
Oh, okay, large. Okay. That's C5. C5 use large intestine 18. Large intestine 18. I may have said something wrong, so sorry. And C6, C7, if it's one-sided, use heart 3 because it's a one-sided phenomenon. Now the atlas C1, you can't palpate anyway, but it shows problems in the atlas supposedly show on the mastoid all the way to the side outside gallbladder 12. And then use Yao Tong Shui, and here you have Sanjiao, because Yao Tong Shui is Sanjiao 3 plus another point more towards the large intestine channel. And I prefer the Sanjiao 3. I almost never use the Yao Tong Shui that's closer to the large intestine. I always use just Sanjiao 3. Okay. If they have pain on the occiput, if you feel it's related to the autonomic nervous system or blood pressure, use the point under the third toe. Now, there's a trick here. Under the third toe releases the occiput, opposite side. It's one of the few points that go opposite side. Okay. If it's hormonally related, use UB66. If it's only on the right side, use left stomach 27. It's the Oketsu business. For the whole occiput, you can use bladder 2, Yu Yao, or gallbladder 14. I'm going to show you a whole slide on that in a moment. If the mastoid is puffy, it might be related to an autoimmune disorder. Now, so then you use liver 13. That's the same point that we use for deep pain kind of things. And for any kind of neck issues, always look at T3, T4, T5. Okay, that's the base of the neck. So I will needle, and you know, the point at T3 is called the pillar of the body. Shenju. Okay, so it's very important. T2, T3, T4, T5, very, very important for the neck. Okay. Oh, I guess my slide that I was going to show you is somewhere else. It will come in headaches, that's why. Okay. The shoulders. First of all, release the neck because that's the blood supply to the shoulders. So release the neck, which we've just talked about, including addressing any thyroid issues. And with shoulders, look if it's a left shoulder or a right shoulder, consider the possibility that underlying the shoulder issue could be a cardiac issue if it's left or a liver issue if it's right. Then I also have these so-called wrist points, you know, which at the end I can try them. So that's lung 9 plus large intestine 5, or pericardium 7 and Sanjiao 4, or heart 7 and small intestine 5. Okay, so these are options, you know, to add. But before I go there, I'm going to try and treat the shoulder, you know, more systemically. Okay, so I release the neck. I look at left and right. Then if they can't raise the arm and they have tight pectoralis, lung 1, lung 2 area is tight. Okay, that's a gallbladder 26 indication. So, but first I use kidney 7 to release gallbladder 26. Then I use gallbladder 26. And I also look at Sanjiao 16 and or small intestine 16. They are 1 sun apart from each other. These 2 points have the character window in them. Okay, so the window, there are 2 different kinds of window. One is a yo and one is a chuang. They're slightly different characters, but they both have the character window. Okay, a window treats and a shoulder, okay, that the shoulder is a door inside the body. That's how it's written, because a shoulder is like a hinge, just like a door is. Okay, so use windows to treat doors kind of phenomenon. Okay, so that's about Sanjiao 16 and small intestine 16. Then sometimes gallbladder 26 is not enough. It doesn't release the ability to raise the arm enough. Okay, so then I'll use gallbladder 22. Okay, needle downwards towards the table, so that because they're facing up. So I'm looking at gallbladder 22 and needling it towards the back. Small intestine 9-10 is a great point for shoulder problems. So Carl asked me about large intestine 15, and I said, okay, well, you can use small intestine 9-10. And here, if you're looking for a particular point to release on the shoulder, you may need to direct the needle slightly in different direction in small intestine 9-10. The general direction is up and out towards the deltoid. But you may find that a particular angle does a better job, say, for large intestine 15 for that person. Immune point and lung 5 are great points for the shoulder. And we talked about the windows to treat the shoulder. So that's Sanjiao 16, small intestine 16. And for the deltoid specifically, bladder 42, 43, needle towards the scapula is great for the deltoid. Okay, so those are tricks for the shoulders. If now we're talking about the shoulder, so up to now we talked about the shoulder as a joint. Here we're talking about the shoulder as an area. The trapezius use inner yin. The rhomboids use the trochanter. Gallbladder 21 use spleen 9. You can see this is almost like talking about the same things that we talked yesterday, but just from an orthopedics perspective. Okay. For the elbow, okay, what you need to do first and foremost is, again, release the neck. Anything to do with the arms, release the neck. Anything to do with the legs, release the sacrum and L5. Okay, it makes sense, right? So sometimes the elbows are related to twisting, you know, because people like think about golfers or tennis players, you know, so that's related to a twist. So again, you'll use gallbladder 26. And before you use gallbladder 26, you might use kidney 7. Okay. Now, the elbow I'll show you a slide afterwards about names of points and stuff, but the elbow, the large intestine 11 is called the bending pool. And there are a number of different pools in the body. For example, Sanja 4 is called Yangqi, the pooling of the yang. There's a pooling of the wind. There's pooling of a number of things, but what does it mean to pool the bending? Chu is to bend. I believe what they're trying to say is that this is the place where what's being pulled here is our ability, our flexibility, our ability to bend and stretch. Okay, so therefore I'm using, for the elbow, I'm often using liver 8, number 1, because the elbow has a lot of tendons in it, and liver 8 is a tendon point. And secondly, the name, the bending spring. Okay, so it's not so much that I'm using the knee for the elbow as much as I'm using the point names and the ideas behind them. But that's just because that's what I happen to be doing. It doesn't mean it's wrong to use the elbow for the knee. It's just my way of thinking is a little different, but I'm arriving at something similar. Then, if they have tennis elbow, which is on the large intestine channel, use heart 3 to release it. If they have golfer elbow, which is on heart 3, the pain is on heart 3, use the immune point. Okay. For the wrist, release the neck again. It's always, because it's an arm, it's part of the arm. You need to release the circulatory issues, nerve and blood supply first. Release the pectoralis. Okay, so use gallbladder 26. The wrist has a lot of tendons, so use liver 8. But the wrist, because it can go around, can have a lot of torque, and gallbladder 34 is my master point for torque. It's my belief that when they assigned gallbladder 34 and they said, oh, that's the meeting point of tendons, I don't think they really meant tendons, as in, oh, it's good for tendons. I think what they're trying to say is this is a point that controls torque when things get twisted in the body. Okay, and tendons tend to get twisted. And that's why gallbladder 34, they say master of tendons. But if you're looking at tendons as in weak tendons that need more blood, gallbladder 34 is not going to be your best point. Liver 8 will do a better job. Okay? And because you're releasing the neck, you're likely to be using kidney 7, spleen 3, and immune and or Sanjiao 8 when you're treating the wrist. That's just points that you're likely to be using. That's just the nature of it. Okay. So now we have the fingers. So it's a tendon that's contracted. Often people have fingers that the tendon is contracted. Now, of course, if it's rheumatoid arthritis, different story. Then it's a bone issue and it's an autoimmune issue. Then you're talking about using REN4 because it's autoimmune, and kidney 7. Okay, because it's bone and kidney for autoimmune disorders. But if you're talking about, when the tendon is contracted, that will be a liver 8 kind of phenomenon. Trigger finger is gallbladder 26. I don't have a good explanation for that. Also use REN3. REN3 is called the central pole, Zongji. Use the center for the extremities. Okay, if you want to affect the extremities, the strongest, go to, it's like the extremities is on a rope tied to the center. You want a place that's going to affect it the most, go to absolutely the most central place. So that will be true for toes as well, for example. Okay, REN3 affects the extremities. Gallbladder 21, it's called the shoulder well. Jingjian, and the Jing here, it's the same as Jing point. So there's this understanding that gallbladder 21 opens up the Jing well points of the hand. So often for finger problems, you want to either resolve or needle on gallbladder 21. Okay, so I know that's not on the slide, I'm sorry. Hip problems. Best point for hips basically is spleen 9. Okay, needled upwards. And L3 on the back, lumbar 3, relates to the hip. But also always consider kidney 7, because the hip, on the one hand, it's a joint, but there's a lot of bone phenomenon going on there. So kidney 7. And also because it has to do with a whole way we're bending and carrying weight. So that will be a stomach 41, the hinge on the other side of the leg. Or possibly the stomach chi might do it. So those are your best tricks for hip that I have. Okay. The knees. So we're looking at my first choice is going to be stomach 41, needle towards kidney 6, and spleen 5 together. Okay. If that doesn't work, then I'm going to look for the stomach chi points. Then release the IT band. It's not so much the tensor fasciae lata, which is the muscle at the top, but the actual IT band. Okay, release the hamstrings. Okay, because what happens, a lot of knees, what happens is that the IT band pulls on the knee, it's too tight, or the hamstring and the quads are not coordinated well. Many knee problems, what you need to do is strengthen the quads. Okay, and look at the stomach chi. Okay, so we talked about that before, stomach 41 and stomach chi. Gallbladder 26, specifically if you have inner knee problems, not so much outer knee problems. Even though gallbladder 26 is on the gallbladder channel, it actually treats more the spleen channel in the knee. And definitely the sacroiliac ligaments, very important for knees. Now, what I do in order to encourage the quads is I use stomach 34 and spleen 10 together, and sometimes I add stomach 32 just to activate the quad, to get the quad more engaged and supporting, lifting the weight off the knee. Many people can have all sorts of meniscus and blah, blah problems in the knee and manage perfectly well without any surgery, without any intervention, simply because they have enough strength in the quads to lift the weight up off the knee, as opposed to sinking into the knee. Okay, so often the problem is not so much, okay, you have a tear in your meniscus or the ACL. Okay, yes, that can be the case, granted, but in spite of that, people can have a perfectly good functioning knee as long as the quads are strong enough. Okay, so that's kind of worthwhile noting. So now let's look by location for the knee. Okay, the inner knee, I will look at spleen 4, and that might be possibly on the other leg. So either same leg or opposite leg. And, you know, you might as well add pericardium 6. These locations, they come from Ito. So you see there's a lot of opening points for the extraordinary meridians. Outer knee eye is considered gallbladder 41 and Sanjiao 5, and that's all the same side. Liver 8 area is a kidney 6 indication. The back of the knee is kidney 7. Okay, UB40, if you have pain on UB40, that'll be kidney 7 and UB23 when you get to the back. Now, if you have tight quads or the hamstrings and the quads can't coordinate well, creating the knee pain, on the back, I needle bladder 20. Okay, and what I do is they're lying face down. I pick up their ankle and I start bending the knee. The ankle goes towards the buttocks. And I ask them, where is the pain? Is there a place where there's pain? And they say, oh, here at a certain angle. And I don't press anymore. Now I press in bladder 20 downwards towards the buttocks. And I ask, okay, I release the leg a little bit. How is it now? Is it better? Can you bend the knee more? Is it more comfortable? And usually the answer is yes. Okay. And then if it, go ahead.
Pour le cataracte, est-ce qu'on tient compte du pouls?
For liver, for spleen 4, we take into account the neck.
I am not understanding the question. The connection between spleen 4 and the neck is not clear to me.
Ben, en fait, à un moment donné, il disait que si le pouls était lent,
One time, Oh, le pouls. Et, oh,
Ou quelque chose comme ça. C'était pour une autre condition. Non, le 4. Oui, le pouls.
okay. Yeah. And she says if there's a slow pulse,
Ah,
then
not
we
slow.
use spleen 4.
No. Okay, misunderstanding. It's about weak or large. It's a weak pulse versus a
C'est un
flooding
pouls
pulse.
faible ou un.
Okay, so if you're using spleen 4 just for the knee and there's no chest problems, don't worry. You need to worry about spleen 3 for
OK,
weak.
parfait, merci.
Okay. Perfect. Okay.
She got it.
Yes, I understood. All right. So,
Oui, c'est
and
beau,
then
merci beaucoup.
you're welcome. And then you have, sometimes you're not sure, sometimes the patient can't say where it is. Okay, so you might try liver 3 and heart 6. That might do a good job. Now, I will say something about ACLs and meniscuses because they're the big ones. So, and I've talked about it with a number of people, and some agree, some don't agree. But it's interesting that there is enough people who agree. So when I first became an acupuncturist, no one heard about ACLs. This was 1992. Oh, the ACLs just came into fashion. Okay. But before that, in the 80s,
I don't know what ACL refers.
anterior cruciate ligament. I don't know what it is in French. I'm sorry. But there's a number of ligaments in the knee. So you know what? It doesn't matter if you know what the ACL is, because that's exactly my point. Nobody knows what it is. There's an ACL and a PCL, posterior cruciate ligament. Okay. These ligaments sort of stabilize the knee from front to back. Okay. And then you have your meniscus. Okay. Now, before I became an acupuncturist, meniscus was the only thing anybody ever heard about. You know, surgeries from meniscus tear, meniscus tear, meniscus tear, and everybody would have surgeries for meniscus tears. In the early 90s, suddenly everybody started having ACLs. It was the popular diagnosis was ACL. Okay, and everybody had surgeries to repair their ACLs. Nobody had surgeries to repair the meniscus, and that lasted about 20 years. And I started talking about it. I said, well, what happened to the meniscus? How come it disappeared? And nobody could answer. And it's interesting. So I've talked to a number of people and they said, yes, it's the same thing. It's almost like it's a fashion. It depends on when, you know, depends on, and nowadays they have both ACLs and meniscus. They decided to, some people are this and some people are that. But it's interesting that even surgeons who are actually repairing the ligament, the tendon that they're naming it, don't seem, you know, it's impossible that all the patients only have ACLs. But that seems to be the main operations, is only ACLs in the 90s. There were no meniscuses almost. So it's weird. So I kind of think that it almost doesn't matter what you do, which tendon you're going to deal with, which ligament you're going to deal with. It's somehow going to do the trick. Okay, so it may not be as important to diagnose it. Okay, which one is which? Okay, so the meniscus will show on the inner knee eye itself. I'm sorry, meniscus shows above spleen 9. The ACL shows on the inner knee eye. You see, I can't even remember which is which. It's not so important. So you just palpate the knee and go with that, because people will tell you it's ACL and you can't be sure that it's even correct. Honestly, you just can't. So those are the treatment points for knees. And now we're moving to the ankles. So usually what you have is an ankle sprain, and it's usually going to be around gallbladder 40. Okay, so for that, your best point is kidney 7. And then you can use the trochanter, okay, which means gallbladder 29. Again, to lift the weight away from the ankle, to create space so the torso, the body is not sinking into the leg and then the leg is sinking into the ankle. Or you can also use gallbladder 31, or you might use gallbladder 34 for the ankle. Okay. So, but first and foremost, I will use the gallbladder points above, but first and foremost, I would use kidney 7. Now, some of these people, if you use gallbladder 43, 44, that's metal water, that will do a good job for some people. Absolutely. Okay. And now we're moving to the feet. So for heel pain, generally I'll use stomach 41 and angle stomach 41 towards the pain area on the heel. Okay. If they have plantar fasciitis, I use the immune point because the plantar fascia is similar fascia to the nose, interestingly enough. They have the same origin apparently in uterus. Okay, in the development of the fetus, the fascia of the plantar fascia and the fascia of the inner nose come from the same place. Okay, therefore, an immune point really does work well for plantar fasciitis. And I use kidney 7 also. Some that's another interesting phenomenon where it's not always easy to tell which is plantar fasciitis and which is a bone spur. Of course, if you have an x-ray, they can say for sure it's a bone spur, but many people will have they have an x-ray that shows a bone spur, but they're treated, they're told that they have plantar fasciitis. Okay, so it's because the spur can press onto the fascia of the arch. Okay. Okay, so now if you have abdominal pain, so now we're moving into more organic pain. So of course you need to check the organs, etc. But besides that, you want to check all the fire points of the Legian meridians. That's kidney 2, spleen 2, liver 2. And consider the metal water points for those meridians. So for liver, the metal water is liver 4 and liver 8. For spleen, the metal water is spleen 5 and spleen 9. And for kidney, it's kidney 7 and 10. Okay. Then in abdominal pain, always check for weak pancreas and treat with adrenal treatment plus lung 5 plus spleen 5. If it's an inflammatory condition on the abdomen, use spleen 5 and liver 5. And liver 4 is a great point to smooth the whole abdomen. I showed you that connection in the character between liver 4 and stomach 30, for example. Okay, and liver 4, the name is Zhongfeng, the center's authority. Who takes charge of the center being the abdomen. Okay. And now we have a whole section on headaches, and hopefully I will not be giving you a headache by going over it. So, according to Nagano, who is quote unquote my grandfather teacher, okay, the teacher of my teacher, he says that headaches are related to tight blood vessels, that they are basically stress headaches, which means that you don't get enough oxygen. And carbon dioxide gets accumulated in the head, and that's what creates the headaches. That's his idea. So his treatment is directed at opening those blood vessels, both the blood vessels inside the skull, if they're constricted, and the blood vessels in the neck that allow for better circulation in and out of the brain. Okay, that's his idea. Okay, so let's start with headache treatments by looking at the different pulses. Okay, for a weak pulse, we've seen all this before, by the way. Weak pulse, not enough blood, we use spleen 6, spleen 9, and pericardium. Check pericardium 8 and determine which pericardium points to use. If the pulse is wiry means it's an excess pulse. There's that stringiness to the pulse, but it's also strong and it does not disappear on pressure. That kind of pulse you find with people with brain disorders, brain injuries, Parkinson's, things of that nature. That wiry pulse calls for gallbladder 39 and spleen 9, both of them needled upwards. If the pulse is tight, so that means the pulse has a stringy quality, a tight quality to it, but it's it's not an excess pulse. And when you press on the pulse, that tightness disappears, and it either the whole pulse disappears or the pulse becomes more rolling. That calls for under the third toe, the blood pressure point. Now you can add REN 6 if the pulse is rapid. And if the pulse is slow, add the Liao points, the UB 31, 32, 33, 34. Add those. And if it's a blood pressure type, that's not exactly from the pulse, but it's from the it's a circulatory still. It's still the same as the weak pulse, spleen 6, spleen 9, and pericardium, and adding under the third toe. Okay, so that's kind of like you start with, okay, we'll start maybe something is in a, in the pulse, in the cardiac phenomenon. So those are trying to address the pulse issues. Then question? Yes.
What about that third toe?
What about the third toe?
Can you talk a little bit more about that point?
Yes, I think I showed you. There was a picture of it, and I'm not
No,
sure
I know
if
the location, but
oh, okay. What do you want to know about it?
it's as if I do not understand the link.
You
It's just
don't understand the link.
How did they arrive at those points? To me, it's a mystery.
Oh, okay. So you okay? This whole combination for blood pressure, are you talking about? Are you talking about the blood pressure combination?
Yes.
Spleen 6, spleen 9 per. Okay, all right, fair enough. Okay, so blood pressure. Who control? Okay, so go back to your basic theory. Who controls the blood? The spleen controls the blood, right?
Spleen and liver, to me.
No, I don't believe this. There's this. Who
The liver
controls the blood in the
blood,
vessels? Hold on,
yeah,
hold on.
okay. I see. The circulation. Yes.
Controls the blood in the
Heart.
vessels is the spleen, as far as I know, as far as I remember, at least. I could
Heart.
be wrong. Okay, so that's the spleen. Now, when you were talking about pressure, think of the different organs and the notion of pressure. Pressure, think of mental pressure. Which organ has that quality? It's the spleen. Too much thinking is like too much pressure. Okay, anger is not too much pressure. Anger is releasing pressure. Sadness can be pressure, granted, in the lungs, but it's not exact. I mean, the one that fits the most is spleen. Spleen has something to do with controlling the blood. Spleen has something to do with pressure. Okay, I understand that when you're looking at TCM theory, the standard textbook theory, it doesn't match up to what we're used to. Blood pressure has to do with liver yang rising or spleen. Oh, well, no, low blood pressure has to do with spleen Qi deficiency. So, it's, for me, blood pressure relates to the spleen. So therefore, spleen 6 and spleen 9. The pericardium is the envelope around the heart, is the network that surrounds the heart. Okay, the pericardium itself is Shinju or Shinlua. It has the same character as the loa, the networks of the vessels. Okay, so it also has a strong connection to the blood and the vessels. Okay, also remember that in traditionally, so to speak, we try and avoid treating the heart, so we prefer to treat the pericardium. It's a vascular disease. It's a disease in the vessels. Now, of course, yes, we have a master point for vessels, which is lung 9, but lung 9 does not seem to affect the blood pressure in the vessels very well. Okay, but we also have a channel that has to do with vessels, the pericardium. Okay, so that's the explanation for that part. Now, under the third toe. Okay, so let me stop the share so you can see more clearly. Under the third toe is this on the hand. What is this in the hand? Pericardium, right? Okay, so you see how now. So it really comes back to it's a pericardium, therefore an autonomic nervous system disorder point. Now, but originally that point comes from you know, the guy they take incense stick and they see which Jing well points get heated the most. Akabane. Okay, so you know, Akabane did experiments and he said, okay, this Jingwell point, and his main thing was which shoe point and Jingwell point relate to each other. Okay, so usually the Jingwell point relates to the shoe point of the organ of that channel. But then when he comes to the foot, he goes, wait a second, that third toe doesn't have a Jingwell point, right? The third toe does not have a channel. It has the muscle channel of the stomach goes to the third toe. Okay, so but when he experimented, what he saw is this, the third toe was, because he was experimenting, he said that third toe is related clearly to bladder 17, to the diaphragm shoe or the autonomic nervous system shoe. Okay, so that's my best explanation for the under the third toe. I don't have a better explanation. Sorry. Okay, Louise. No, no. There's someone else. Another Louise one has a question. It looks like Luis Filippo.
I might need a break.
Okay, so let's take a 5-minute break and we'll get back to Luis Filippo. Is that okay, Louise?
Yes, I don't have any question.
Oh,
Sorry.
you had a hand raised, so
Yeah.
on the thing, no
I
problem.
forgot.
Okay, so let's take 5 minutes and we'll come back at 11:12.
Thank
Okay,
you.
thank you.
Ready when you are, sir.
I'm sorry, I was not on. Okay, we'll start again.
Go
So
ahead.
always with headaches, make sure you release the neck, because it's the pathways of primarily of blood, but also in some ways nerves. The nerve supply doesn't exactly go up to the brain, but the feedback does. Okay, so again, if you have the scalenes, release spleen 3, lung 8, release them with spleen 3 or lung 8 or heart 3 or inner yin or all 4. You never know which ones you're going to need. Release the SCM. That's opposite Sanjiao 8, 1/3 below the elbow. Or if the pulse is rapid, use Sanjiao 5. Release the occiput. So if it's an autonomic nervous system issue, use that under the third toe that we just talked about before the break. If it's a hormonal issue that reflects on the occiput, use UB66. Also for the occiput, you can use bladder 2 or gallbladder 14 or Yu Yao. The occiput itself also relates to eyes. Okay. And if it's the cervicals, use Sanjiao 8, liver 8, kidney 7 or 9, although the original is kidney 10. And remember, with the cervical, sometimes instead of liver 8, I'll use inner yin. Okay. Whoops. Sorry. Then other things that can happen with in headaches, so other signs. This headache section is quite long, so it will give you a bit of a headache. So just bear with me. So if somebody had a head injury and now have a headache, okay, that again is that basilar artery insufficiency treatment, Sanjiao 8, liver 8, kidney 7 or 9, and the ihikon, okay, which is bladder 60, bladder 58, and bladder 40. Or I sometimes call it ihijang, okay, because instead of kunlun, I use xuanzhang, gallbladder 39. Okay, so it might be gallbladder 39, UB58, and UB40. Headaches with eye problems, that may reflect on the occiput. I'll use bladder 2, and bladder 32 is a good point for eyes. And at the top of the SCM, they'll have tightness at the very top of the SCM. So I needle from behind the SCM up towards the jaw. Okay. And always considered the jaw, TMJ. Now, supposedly the headache will be occipital or temporal, but it can be anywhere because the jaw can create tension anywhere. So use the adrenal treatment, kidney 9 and 27, and Sanjiao 8. And at the center of the chin is a good point to release the jaw. Okay. Now we're going by location, like, you know, they do the standard stuff that they do, you know, frontal headache, side headache, you know, et cetera, et cetera. So if you have a temporal headache, you know, so it's just like the TMJ, it's kidney, and they have TMJ, use kidney 9, 27, and Sanjiao 8. Release any SCM tightness for the temporal headache. So that's opposite side Sanjiao 8. And then your trump point for temporal headaches are the immune points, just below large intestine 12. And you can use 1, 2, or 3 points on the immune points for temporal headaches. You don't just need to use 1. Frontal headache, generally, I use the immune points. At this point, I just need 1 point. Okay. I know people like to use, you know, stomach 43, and that does not seem to do much for me. Sorry. If they have pain around the eye, okay, that's considered a hormonal headache, and that is a liver 2, heart 3, and bladder 59 combination. And if the pain is behind the eye, meaning deeper in the skull, involving the eye, that's a liver 9 indication. Okay. Vertex headaches, okay, they can be hormonal, although headaches around the eye can be hormonal also. Okay. So if you think it's hormonal, use bladder 66 and or small intestine 3. You can add small intestine 3. So just as a point of interest, small intestine 3 is called Hu Xi, and small intestine 2 is called Qiangu. So this is before the valley and after the ravine. Okay, but there's a before and after. The points around Do 20, Do 19, and Do 21 are called before the vertex. It's Hoding and Xianding, before and after the vertex. Okay, so the only other place where we have before and after, besides around Do 20, is small intestine 3 and small intestine 2. There is a connection between small intestine 3 and Do 20. That's the connection of the pituitary, which is underneath Do 20. And I believe that's why small intestine 3, they're seeing a clear connection between the small intestine channel and the top of the head. And that's why they're saying small intestine 3 opens up the Do channel. That's my opinion about how it happened. Because when you're asking people if they use small intestine 3 for low back pain on the Do channel, they will tell you no. We use small intestine 4 more for the low back. Small intestine 3 tends to be a point that people like for the neck and for the head. And small intestine 4 is a point that they like for the low back. Okay, so I'm just bringing up some connections out there. Okay, so one type of vertex headaches is purely hormonal. Okay, another type is a type where there's been damage to the lower abdomen. So the typical one of those is women after they've given birth, they've had very difficult birth, and they have like postpartum depression or postpartum headaches. Okay, and we call that blood stagnation in the head. You will probably, in TCM, they might describe it as some damage to the lower abdomen and yin fire rising, something like that, they might say. And that the solution for that, the treatment choice for that is very similar to the blood pressure, spleen 6, spleen 9, pericardium, with the addition of lung 5. Okay. And often these people will, when you press on around do20, there may be pain. You may feel warmth around do20, or when you rub your hand around do20, you're feeling like the skin is not attached to the skull, that it's almost like separating from the skull. Okay. So that's that combination. You also have people who have insomnia or stress that get vertex headaches. So then you check REN 15 and REN 17. These are considered emotional reflexes. And use the spleen pericardium combination. And then add T5. And then add the center of the heel, Shim Yam, which is a great point for insomnia. It's a great point for insomnia. It's a great point for pain. It relaxes the brain. Okay. Also know that do20 is related to both the chin, so the center of the chin, which I'm using for the jaw also. The center of the chin is related to do20, and spleen 6 affects do20. And also REN 3 and REN 4 can be related to the top of the head as well as the forehead. Okay.
Sorry, you're talking about the shin. Go back to the other slide.
The chin, yes, the chin.
Okay, the chin. Okay, it's not the shin bone. Okay.
No, the chin,
yeah,
the
okay.
center of the chin, like on the REN channel, below REN 24. Okay, so, all right. So occipital headaches, and we've basically done most of this. We've done all of this before. So you have bladder 66 if it's hormonal. If it's right side only, then it's possibly Oketsu. So that's left liver 4 and lung 5, and then left stomach 27. If it's a blood pressure or an autonomic nervous system type person, use under the third toe. But remember that it's the opposite under the third toe to the occiput. Occiput on the right, third toe on the left. Okay. And then bladder 2 or gallbladder 14 or Yu Yao, any of those, and I think it's the next slide, I'm actually showing that connection. On the back, use T5 or T3 or something like that. Use do2, especially if it's an autonomic nervous system type. Use L5 in the sacroiliac. You know, this is kind of, standard sacrum and cranial kind of connections, and the correct tendon area, which is the, anywhere on the bladder or gallbladder channel on the shin. This is the shin with an S this time. Okay, so this is the correct tendon area. We've seen that one before. Okay, releasing the back of the neck and the occiput. And here, what you're seeing is, so this is this muscle that goes from the eyebrows all the way out to the occiput, okay? Except that on the skull, it's considered like a tendon. So it's a tendon that's, so on both sides, there's a muscle, okay? So the forehead is a muscular part, has a frontal belly. So that's bladder 2, gallbladder 14 and 15. You have on the occiput, you have a belly of the muscle, and that's bladder 10, gallbladder 20, gallbladder 12. In between, you have that white part, which is the aponeurosis. So that's your gallbladder 16, 17, 18 kind of thing. And then you have another muscle over it. On the side, you have a muscle going down to the ear. And that's your side gallbladder points. So the gallbladder is basically this whole epicranius muscle. Okay, so this is why, because of the physically, why bladder 2, gallbladder 14, 15, Yu Yao can treat the occiput and the other way around. It's through this fascial connection. And you can also say that the side gallbladder points, say gallbladder 5, 6, 7, can also treat occipital headaches. Okay, or Sanja 22 is in there also on this side. So this is the connection between the occiput and the forehead or the eyes, and the sideburns area and the occiput and the eyes. They're all related through this structure. You know, they're all basically part of the same muscle. Okay, and it's a good trick to use because sometimes you can't diagnose what's going on. Like they have, you know, it's not hormonal, or the hormone UB66 got you a little bit of relief, but not enough. And then you go, oh, okay, let me check something in the forehead and see if I can gallbladder 14 or UYAO or UB2 and see if I can really kick the occiput off. Okay, so it's kind of a local phenomenon in a way, but it's worth dealing with. Okay. General points for headache. Okay. Some people actually, when someone comes to them with a headache, the first thing they use are the bafangs. Those are the yin spring points of the foot. Those points oxygenate the brain. They open up the circulation in the brain. I don't like using it up front. I like doing it at the end. And the reason why I don't do it when somebody comes, put them on the table and needle bafang, is because if I do that, then I don't have a lot of options to check other things. I prefer to check all my other options and then do the bafang as extra. But some people say, oh, I want to get them out of pain. Most important thing is that, you know, they're coming with a headache. I just want to release their headache. Okay, but if I do that, it doesn't give me as good a diagnostic capacity as if I did not use them. So if someone is absolutely in horrible, horrible, horrible pain, fine, I'll needle the bafangs. Okay, first, but generally speaking, I won't. Now, you don't have to do all 8 of them. You can, the strongest ones generally are the liver one and the gallbladder one. Okay, so you can let go of the stomach and the one between the stomach and the gallbladder. So
you might repeating the points.
Yes, no problem.
For bafang.
Yeah, the bafang, they're basically the yin spring points on the foot, right? And the most important ones are the liver 2 and gallbladder 43. Okay, the ones in the center, which is stomach 44, and the one that's between stomach 44 and gallbladder 43. Those you can skip. So instead of doing 4 on each side, you can do 2 on each side on the bafangs. Some people like to save needles. And also generally for headaches, make sure that you're releasing T2 through T4. Okay, so there's a great trick for that because, you know, because the person's lying face up first. Use the ear occiput point. Okay, which is, I don't have a picture of it, unfortunately. Let me see if I can, let me stop the share and see if I can show you. So if you can see my ear, and I'm not a very good ear person, so I don't know the different parts, but it's this bump here, and it's at the top of the bump. That releases T4. It's a very good point to release T4. Okay? So if you look at ear occiput in a text, you'll find it.
Can you show that again with something besides your finger because you're hiding your ear?
I can try, but I'm not sure if it will help, but okay. So
thank you.
Hold on. Is that good? It's at the top of the bump.
Yeah. Better.
All right. Sorry, I should have taken a picture of that and shown it to you on the slides. So I apologize.
Thank you.
All right. So, and also sacroiliac points are good for headaches in general, because the sacroiliac and especially the liao points, they are sitting on top of a parasympathetic ganglia. So it's not just craniosacral, it's also that they're actually sending a parasympathetic message into the body. Okay. Also Ren4. Ren4, the name of Ren4 is Guan Yuan. Okay, the gate, Guan, Yuan to the primary. This primary is written like a head over the feet, meaning not source, but primary. It comes from the head, it's primary. Okay, so Ren4 has a very strong connection to the head, more so to the frontal part of the head, the forehead and the vertex than other parts of the brain, but anything in the skull, you can start to think about REN4 also. Okay. So, all right, so we're moving into a different subject, and it's 11:30. So, okay, so I'm actually going to keep these slides for later, for after lunch, and let's move on to a different set of slides. So, okay. So this came, I asked if people had specific questions in advance, specific kinds of pain that people would like me to talk about for the class. And I got this list from Lillian. Okay, so this is the list. Okay, now I know you don't have these slides, and that's okay. Okay, and I'm basically answering all of those. So she gave me a long list of questions of pain problems, and she wanted to know, what would I do for these pains? Okay, so these are the answers. All right, so for sinus pain or frontal headaches, we just did something very similar. Okay, so the sinuses are going to reflect on bladder 2, on stomach 2 or 3, or large intestine 20. They're going to reflect on the side of the nose. Okay, and my best treatment for that is the immune points. I may needle around the navel for nose issues. Why? Because the nose is in the center of the face. The navel is in the center of the belly. Where did you breathe from before you were born? When you were in uterus, your breath came from the navel. Your oxygen supply came from the navel, right? So there's a strong correlation between the navel and the nose. And I also use gallbladder 40 for nose issues, especially if there are kind of deep-seated nose problems. And then do 24 or do 23, or possibly do 20. And those points, it doesn't have to be exactly on the do line. Sometimes I find a point that's a little to the side and works really great. Okay, so that's for the sinus pain, which is different than frontal headaches. Okay, they can be related, but might not. So for frontal headaches, first I release the neck, and I use the immune point and Sanjo 8, etc. I use the Bafang. I use REN4. Okay, unless the pulse is slow. I don't use REN4 if the pulse is slow. And then I use the gallbladder 12 area. So again, this is the idea of the occiput treating the forehead. Okay, or around gallbladder 2, the side gallbladder points. So if the headache, if it's not too close to the headache, I can use, gallbladder 8 or 9 or something like that, to treat frontal headache on gallbladder 14. Okay. The next question was, what do I do for jaw pain at the articulation? So I'm assuming AMT is the same as TMJ. That's the French version for TMJ.
Yes, indeed.
Yeah. So
yes, it is.
I'm just assuming so jaw pain generally is, I do adrenal with kidney 9. It can be a different kidney point, but usually it's kidney 9. Sanjiao 8, the center of the chin, okay, below REN 24 at the center of the chin, and behind gallbladder 21. Okay, and then if there is tension in the muscles, and because she asked about the joint itself, but I'm saying, but we had this question yesterday, the same thing, that there's a difference between the joint and the jaw muscles. They're in a different place actually. So for what I do is I add Sanjiao 22 if there's stress, and I treat the autonomic nervous system. So for example, under the third toe, spleen pericardium, etc. And with spleen pericardium, I would prefer to use spleen 3 because it's a muscular issue. Okay, spleen 3 is a good point for muscles. Okay. And Occipital headaches, we've just gone through all of those, so it's kind of funny that sorry, I didn't realize that it was going to happen like that. So pretty much we're seeing the same thing. If it's hormonal, use bladder 66. It's right side only, use the oketsu. If it's blood pressure related, use under the third toe. And then you can use that connection of the front, the forehead and the occiput treat each other. Okay, and on the back, use T5, T4, T3, T2. Do 2, use the sacroiliac ligaments and the correct tendons area. Okay, so I believe I'm going to now show you the correct tendons area again. You've seen this before. So it's an important area. Okay, and again, that picture of why the frontal and the occipital relate so strongly to each other, why they treat each other. Okay. Next question was, what do I do with a cervical hernia at C6, C7? Okay, so it's cervical, but it's a spinal thing, which means it's a bone. So I'm going to use kidney 7 because it's bone. Okay. And then I'm going to use heart 3 because heart 3 is good for C6, C7, but I'll only use it if it's one-sided only. Okay, I won't use heart 3 if it's both sides. And then I'll use stomach 9 and or large intestine 18. Or even better, I might come from the back. So instead of going from the front of the SCM, okay, and use stomach 9 or large intestine 18, I might go to small intestine 16 and needle, it's another window point, and needle small intestine 16 or Sanjiao 16. They're very close to each other, okay? And towards the front. So either stomach 9 towards the back or Sanjiao 16, small intestine 16 towards the front. And also, remember, Ren 12 is a very good point for anything spine issue. So I needle Ren 12 or Ren 13. So I can, on the spine, I can say Ren 10, Ren 12, and Ren 13 all share the same name. It's one. One is called the upper one, the middle one, and the lower one. Okay, one or guan, depending on the character. You can have either way. So I can, with Ren, I can use Ren 12 for all spinal issues, or I can say maybe Ren 13 does a better job for higher, for the neck. Maybe Ren 10 does a better job for lower spine, for the lumbar spine. Okay, but this whole area between Ren 10 and Ren 13 is helpful for the spine. And then for the cervical hernia, I still have to release the scalenes because the blood supply still comes from this area. So that's your spleen 3, your lung 8, and your inner yin. I didn't put heart 3 here because I already had heart 3 above it. And on the back again, the neck is related to, the neck and the head is related to the upper thoracic, the T3, T4, T5. And I'll do the sacroiliac ligaments in L5. Okay. Upper trapezius tension. So that will be inner yin is a great point for trapezius. Spleen 3 is a great point for muscular issues. I need to release stomach 9. If there's any tension around stomach 9, it needs to be released. Okay. Why? Because the blood, the nerve supply to the trapezius comes from the area of stomach 9 or from behind it, small intestine 16, Sanjiao 16. If it's gallbladder 21, because trapezius is a large area, if specifically you have pain on gallbladder 21, use spleen 9, needle upwards. Okay. If it's upper trapezius also includes small intestine 13, Sanjiao 15 area, then it's possibly a hormonal issue. So either use small intestine 3 and or UB66. If, on the other hand, it's not trapezius, and it's hard to tell which is which sometimes, right? It's the levator. The levator responds really well to bladder 2 at the eye. You can do bladder 2 or you can do bladder 2 with Yu Yao. You don't have to do just bladder 2. You can emphasize it more. Trigger finger is gallbladder 26, same side as the trigger finger, and liver 8 for tendons. You can also add the immune points, and definitely check the neck, check the scalenes especially. Okay. Sharp pain, I'm assuming that this is the V is for bladder 43, 45. So that's Gao Wang Shu. On the right side, it's possibly a liver issue, so I will use liver 1. On the left side, it's probably an autonomic nervous system reflex or possibly a cardiac reflex. If it's autonomic nervous system reflex, use DO2 and sacroiliac ligaments. If it's cardiac, on the front, use REN4 unless the pulse is slow. And on the back, use UB27, which is the same thing as sacroiliac ligaments. Use small intestine 9 and 10, between 9 and 10. And then possibly, because it depends on exactly where bladder 43 to 45 exactly is, the Gao Wang Shu, it might respond to gallbladder 29, because gallbladder 29 allows you to open the chest, to give space to the chest. Okay, it might respond to Yao Yan, the lumbar eye, okay, by opening the spine. And it might also respond to side gallbladder 28 and T11, T12, because what happens is sometimes the scapula, we're lifting the scapula out of the back. Okay, let me stop the share for a second, so it might be easier to see. If you don't have a good enough support in the legs, okay, what happens is you start lifting your shoulders up to lift your body up. So then you might have tension on UB43 area, because you instead of allowing the shoulders to relax into the back, we're lifting it up this way. Okay, so we're creating the sense of the perineal floor with side gallbladder 28. Okay, in order to allow the scapula to relax, the scapula doesn't have to hold you up. Okay, any questions up to now? I know it's hard. It's a lot of lists of points. It's kind of boring. All right, so we'll continue for a few more minutes and then air ourselves out for lunch. All right. Okay, tennis elbow. Again, look at the neck, release the scalenes with spleen 3. Okay. Use gallbladder 26 because often tennis elbow comes from a twisting phenomenon. Use inner yin both to release the scalenes and to give you the sense of a core support. And the elbow tends to respond quite well to Sanjiao 22. I know I had Sanjiao 22 also for pain in general, for relaxing the brain, etc. But specifically, Sanjiao 22 and the elbow have a correlation. Okay. And above Sanjiao 22, say gallbladder 8 or something, has a relationship to the shoulder. Okay. If the pain is lateral, meaning on the large intestine channel, use heart 3. If the pain is on the heart channel, it's a medial pain, use the immune point, use the large intestine site. Okay. So tendinopathy of the long head of the bicep, large intestine 15, I think is what it says. Okay, so this is, first of all, the first thing I'd look at is the gallbladder 26 business. And I'll do kidney 7, gallbladder 26, and I would probably add inner yin. Okay. Then lung 5 affects large intestine 15. And liver 8, because it's possibly a tendon there. And remember, I just told you that there's, the shoulder relates better with a point around gallbladder 8. So look for something around gallbladder 8. And then on the back, small intestine 9-10, needle towards the shoulder, towards the arm, up and out. And bladder 42, 43, 44, Needle towards the scapula. It's the best one for deltoid, but it also affects large intestine 15. Okay. Capsulitis of shoulder. I'm assuming this means you can't raise the shoulder. The capsulitis. So if it is actual arthritis, use kidney 7 and then add 27 to it as well if you want. Okay, but the main one's going to be kidney 7. Lung 5 is going to be very important. Not you can say, oh, now we're getting into the prednisone treatment as opposed to the adrenal treatment. That's one way to look at it. Another one is just that lung 5 is just really good for the shoulder. Okay, and again, the gallbladder 26. And often when they can't raise the arm, I will add gallbladder 22. Kneel downwards towards the back. And I might do 2 or 3 points on gallbladder 22. Okay, so I was assuming she meant it's a frozen shoulder. So I'm checking around stomach 9 and the scalenes and release it first. And then I can also needle it, but I can also needle it from behind, meaning Sanjiao 16, small intestine 16. I don't have to needle stomach 9. If you're not comfortable with needling stomach 9 from the front, just go from the back of the SCM at that level and needle towards the front. And again, bladder 42, 44, the inner border of the scapula towards the scapula, small intestine 9, 10, and the sacroiliac ligaments. Okay, so you're seeing a lot of repeats of the same kind of stuff, same ideas of treatments. Pain at level of T9, mid-back on both sides. It could be sugar issues, someone who's sensitive to sugar. So then it's spleen 3 with OD and T11, T12. If it's only on the right side, she said both sides, but I gave the answer for right side only. The use opposite UB35. That's left UB35. Okay. And because if it's muscular, use spleen 3 and maybe use OD point, right stomach 22 also. If it's on the spine itself, it's not muscular, use DO2 and use the sacroiliac either way. Okay. And I would still use T11, 12, and T5 because now she's asking about T9 specifically. So those two big curves in the spine at T11, 12, and T5, they will adjust the rest of the spine. Okay. Low back pain at L2 to L5. Well, in fairness, usually people don't have it's 2, 3, 4 vertebrae out of 5, a little bit unusual. It can happen, but usually people have L4, L5, or L5, S1. Ultimately, I'm going to have to do the sacroiliac ligaments on the back, but on the front treatment, the things I would consider for lumbar pain, for lumbar spinal pain, is spleen 9 and kidney 7. Those would be the main things I would consider on the front. And of course, I would look at inner yin to give the back more support. Then on the back, I would use the sacroiliac ligaments. And here, this DO2, because it's specifically for lumbar spine, I may move DO2 higher up. I'm always needling it upwards, but if I'm specifically trying to clear something at L4, L5 with DO2, DO2 may move upwards and may become almost like a sacral point and no longer between the tailbone and the sacrum. It may actually be on the sacrum itself, between, say, UB33s, the two holes at UB33, or even up to UB32, it might be there. Okay, I'm still needling it up, even though now it's on the sacrum. And then also look for any spinal issue or back issue, always look at 4 corners, just as a way of spreading the back out so there's less congestion in the back. Okay. Tendinopathy of finger flexor. I wasn't sure exactly what that meant, but I think it's a contraction of the tendons, which is different than trigger finger. Trigger finger is it clicks, and this one it doesn't go back. But the treatment is very similar. Liver 8 because it's tendons. Gallbladder 34 is an option. Okay. I'm not sure. This gallbladder 36, something doesn't work. Oh, gallbladder 26 is what it's supposed to be. I'm sorry. I was like, so sorry about that. That's gallbladder 26. Now, because usually this tendon contracture, often it has something to do with pericardium 8. That's where the tendon is. Okay, then I would possibly use, that's the fire point. So I would use the metal water points of pericardium 3 and 5. Okay, now it doesn't matter if the contracture is specifically on the pericardium channel, it may be on another channel, but the tendon itself, the tendons for all the fingers is going to relate to pericardium 8. It all comes from the center. All these tendons. So there is a connection to pericardium 8 for almost all the fingers, except the thumb. Okay. Carpal tunnel. Again, release the scalenes, release the cervical. So that's your spleen 3, your kidney 7. Okay. Again, gallbladder 34 and gallbladder 26. Sorry, this is 26, not 36. Okay. And liver 8 because it's tendons. Carpal tunnel syndrome is a tendon syndrome. And possibly I'll use pericardium 3 and 5, possibly. Okay. Raynaud's. Okay. So the important thing here is to release stomach 9 and C5 to open up the circulation from the neck. Okay. And so, and I can use under the third toe. Also, some people that feel cold, it's because of hormonal issues. So that would be UB66. Lung 8 is a point that opens the vessels. Okay. UB42, 43, the inner border of the scapula is about circulation. And small intestine 9, 10 to open up the blood supply to the arms. Okay. Now, the best trick for people who suffer from cold hands and feet are put a heat pack or do moxa on do 14, do 13 area. So I'll talk about that in a second. I'll just explain to you the name of the point. We're looking at circulation. So do 13 is the path of happiness, if you like. Okay. And when you look at the character, okay, for tau, okay, the first character, okay, you see something that's pleasing, and it has something to do with easing a spreading action. Okay, it spreads the circulation. Do 13, the name of do 13 implies that you're creating a spreading. Okay, so what I do when I say put a heat pack on, I don't mean take one of those electrical heat packs and put it on your back. That's not going to do anything for circulation. That's going to keep the skin warm. What you do is you take one of those things that you put in the microwave, and those really generate heat. I personally just take a sock and I fill it with agricultural corn. That's the corn that you feed animals with. It doesn't pop in the microwave. The human corn pops. If you cannot get agricultural corn, just use rice. Three cups of rice, 4 cups of rice. The problem with rice is this: after about 20 uses, the rice starts to cook itself. So you can't keep that sock that you just made is only good for a limited period. The corn socks are good for at least a winter, no problem at all. You can put it in the microwave many, many times. I have them in my treatment rooms, and they keep going. And at the end, I use it the whole winter. Okay, and no, it's not a problem. So I would use that. The only thing about it is you have to make sure that you put it in the microwave for a fair amount of time, like 5 minutes. You don't want it just warm. You want it really too hot to touch the skin, so the heat really penetrates inwards. Now, there is a method of doing moxa, which I don't know if we can do nowadays anymore, because I don't think they sell a lot of newspapers nowadays. But the old style newspapers, you know, that sort of dirty paper that your hands get black from, you know, it's sort of a thin, dirty paper. You fold it a few times and you put the, hold on, let me undo the share so you can kind of see. So you take the newspaper and you fold it a few times and you put it on the area that you want to warm up. And then you take your cigar, the moxa cigar. So let's say I'm doing it on my chin because it's easier to see, okay? And you take your cigar and it's the lit side and you touch the newspaper, but you don't touch and keep it. You touch and take out. Tap, 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 let go. Tap, 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 let go. Tap, 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 let go. And after a few times they go, oh, it's a little too hot. So then you just take the paper away and take the cigar away and put it back on and tap, 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 tap. They say, ouch, too hot. Take the paper away. The paper pushes the heat in. So there are a few advantages. If this takes you maybe a minute to do an area, whereas doing the cigar can take you 10 minutes. So you're saving yourself a lot of smoke, basically. And it penetrates much more than just doing moxa holding the cigar. Okay, so that would be my suggestion for that. So I'm going to suggest that we take some questions if there are any, and then break for lunch. Any questions?
Avi, can you demonstrate where you puncture liver 8, please?
Where I puncture. Okay. Needle is what you use in English. We don't puncture. Puncture implies that something comes out. So, you know, like
Well,
like
you never know.
well, that's true. But you know, like a tire, like a flat tire.
A
is
tire gets a
puncture.
puncture, yeah. I was thinking exactly that.
But so generally we don't use the word puncture for needling. So liver 8, the name of the point is bent. It's the bending spring. Okay, so that means the leg needs to be bent a little bit. Okay, so if you're going to needle liver 8 and the leg is flat, that's not going to work well. What you want, so you can put a little bolster underneath. It doesn't have to be bent like I'm bending. Okay, so it's not really necessary. So, but a little bit bent, and then come from bladder 40 and just come around, go over the tendons. Now, what I'm looking for is I'm looking for something that's going to feel like a little teeny little cyst. So it's a nodule, but it has some fattiness to it. And that's the best liver 8. Now, I know some people take liver 8 up here. That's not going to do it. Okay, so I am really in line. This is kidney 10 here, and this is liver 8 here. I don't do this business. I don't know where that came from. Okay, so it's around here, but I'm really looking for a little bit of a bump. Okay?
Yes, clear, thank you.
Okay. Anything else? Anyone else?
I'm just wondering how many treatments you give to get results. Like, for example, Renaud, I have many clients, patients coming to see me with that, until you can, just to give them an idea. Sometimes it's hard, you know, to say 12 treatments once a week for 3 months, you know, they're
Impossible.
I just want to get an idea.
Okay, so this is an extremely personal choice that people make. It's one of the things that I really don't like dealing with, not with patients and not in classes. So this is what I do with patients, but you know, I'm not a good marketer. I'm not a good office person. I'm not a good any of those things. I tell patients, you know, if possible, please give me at least twice, because the first time, maybe I made a mistake and I need to reconsider what I did. And I'll also explain to them, I'm diagnosing the first time, but maybe what I did on you wasn't quite it. So only when you give me feedback, that's part of the diagnosis. Okay, so I can say, wow, everything looks great on the table. And I think, oh, I solved everything. But then they say, well, you know, didn't work well, or it only lasted a certain amount of time. So it's only when they come back the second time and they say, wow, this worked really great, Or they say, you know, it was great for 2 days, but then it all came back. Or they say it was great for 2 days and it came back, but it's now 50%. So that gives me a clue as to whether the strategy that I took was really good, was good but not good enough and needs extra, or was useless. So that's part of the diagnosis. So, for example, I don't charge extra for the first treatment. All treatments are the same amount of money for me because I might have to re-diagnose the second treatment. I just don't know. So when people call in, I say, look, I suggest you come 3 or 4 times, commit to 3 or 4 times, once a week. I don't do twice a week. I don't like doing twice a week. In my opinion, my experience when somebody has insisted on coming more often, at some point it starts to backfire. They start to not respond. That's my experience. So I prefer once a week. Occasionally I'll take someone a second time that week. For the first week I'm willing, okay, you really want, that's fine, but I really prefer not to. So I tell them, give me 3 or 4 treatments. If you see no movement at all, then forget it. If you see some movement, you evaluate and you decide whether it's worth it or not, because I can't tell you how many treatments it's going to take, especially not without seeing how you respond. Because, you know, sometimes people respond great on the table, but then nothing, it all comes back afterwards. And you can't know that that's going to happen in advance. So you cannot diagnose that until it actually happens. Some people on the table, it's very difficult, but it barely moves, and they're doing you a great favor when they tell you it's 10% better. But then the next day they call you and tell you how it's all gone. How do you know how it's going to work out? So that's why I'm saying 1 treatment is definitely not good enough to evaluate, at least 2 treatments. But I think it's very hard for me personally to ask someone to come more than 4 times. If they're not happy with the results, if they're not seeing a movement, because how can I know that in the 10th treatment suddenly it will move? Has it happened to me that patients have insisted on coming? You know, I would say to them, you know, nothing is moving. I think you should go somewhere else. But whatever reason it is, they decide that they're still coming. And sometimes, wow, after 10 treatments, something started to move. But generally speaking, in this style, things move a lot faster. They're not resolved, but they move. So for me, I suggest to people, look, if you're seeing that there is movement, then you decide if it's worth it for you to continue, if you have the patience. And if not, that's okay. But if you're seeing no movement at all, then it's to me, it's very obvious. Don't bother. Don't bother coming. Find someone else, because another modality might work for you. So it's not worth it for me to tell them come for 3 months, because at the end of the 3 months, they're only going to be angry that I wasted their time and money. And by the way, very few people are willing to come for 3 months on a weekly basis every week. There's bound to be some problem there. It's just that it's very hard to be motivated to come regularly. So I would say most of my patients, anywhere between 3 to 6 treatments, and then they start saying, you know, I'm going to come next month. They start reducing themselves. It's just the nature of it for me. I know I have colleagues who don't take new patients ever for the last 10 years already. They're always treating the same people. And I'm like, how can this be? Because their patients keep coming back every week, and I'm like, well, but isn't it boring? That's a different story. But I'm not the kind of person who encourages patients to come every week on a regular basis in any way. You know, I don't even tell them come once every 3 months for tune-up. They come, they call, they come. They don't call, they don't. I mean, they're grown-ups. They know what they want, or they should. That's my
yeah, fair enough. So for Renaud, you gave us example for the arms, but my patient has like black toes almost when she comes to. Okay. What would be the other for the blood supply to the leg?
Okay.
Yeah.
Okay. So the blood supply to the leg is Yao Yan. Okay, the lumbar eye. and the sacroiliac ligament. So the place to warm up is L5 and the sacrum. So from L2 downwards, you want to warm all that area up. And you want to resolve make sure with the toes, you want to make sure that the calves don't have tension in them, that there's no muscular tension. Because if there's muscular tension in the calves, in the gastrocnemius, that's going to disrupt the blood going into the foot. Now, that's probably not the cause. The calf is not the cause, but it's a contributing factor. So you can alleviate it. The other thing is what I would suggest to them is, because they can do the socks themselves, with a microwave. I have a microwave only for that. I don't eat from the microwave personally. It's not my thing. Okay. But for heat packs, I love the microwave. So what they can do is they can do one pack under, when they're lying down, say they're watching TV or something, or reading or whatever, put a heat pack under the gastrocnemius. That's very helpful. Okay.
Perfect. Thank you so much.
Oh, one more. For someone like that, do check liver 12 area. There may be a blockage around liver 12 that's preventing circulation. It's possible. And with that person,
Sorry, say that again. I didn't catch.
Liver 12, spleen 12 area, there may be tightness there that prevents circulation into the leg. And for that kind of person, after you release it, needle liver 12 up towards the pubic bone to open it further. Okay. By the way, sorry. Liver 12 is also when you have big toe problems, like pain on the big toe, the liver 12 area, or more towards the stomach channel can also be, but around there is the upper thigh is a very good place for big toe problems.
And what if it was baby toe problems?
I don't have a great one for that. Sorry. But,
okay,
but I
you.
would still, but wait, no. The baby toe is still important for me to check because the circulation from the thigh downwards, I'm still checking that. It's just, I'm saying specifically for the big toe gets affected much more than the other toes is what I was trying to say. Okay. Anyone else? Any other questions? Okay. Then let's take a break and we'll come back at 1:10. And think now of any other questions you have, because we have some material to still go through, but this will be kind of like your last chance to ask me direct questions. So do eat your lunch and digest your questions too.